We're
There it
getting
is.
ready. Sounds like I might. That's good. All right, I will do a check-in with technology and staff. Are we all good? Ooh, sorry. I would like to call the November 2025 meeting to order. Public notice of this meeting was properly posted at the South Carolina Board of Pharmacy's office, Synergy Business Park, Kingstree Building, and on the board website, and provided to all requesting persons, organizations, and news media in compliance with Section 3480 of the South Carolina Freedom of Information Act. If you will please stand for the Pledge of Allegiance and remain standing for the invocation.
Right. Heavenly Father, we come to you grateful and humble this morning. Opportunity to serve. We do pray grace and the wisdom to make wise South Carolina and to do so according to your will. Today, thank you for all safe travels. Respondents today and their travels. And we pray all these things in your name. Amen.
Thank you, Schuler. Okay, so the board members will now introduce themselves. We'll plan on just going in a circle here. So I am Mary Douglas Smith, the current chair of the South Carolina Board of Pharmacy. I represent Congressional District 2. I'm from Chapin, South Carolina, and I work in a health system.
Schuler Spagner. I represent Congressional District 3. I work for a community grocer, live in Gray Court, South Carolina.
Good morning, I'm Beverly Black. I'm the appointed public member to this board appointed by the governor. I live in Charleston, South Carolina, and I have a long history in health system pharmacy.
My name is Cassie Eunice, and I live in Swansea, South Carolina. I represent Congressional District 6 on the Board of Pharmacy, and I work in independent pharmacy and compounding.
I'm Larry Meek. I represent Congressional District Number 5. I live in Rock Hill, South Carolina, and I'm an owner-operator of an independent pharmacy.
And my name is Joe Garcia. I'm from Charleston, South Carolina. I'm an appointed member as well, and I work for independent retail compounding.
I'm Rebecca Gillespie. I am the member at large appointed by the governor, and I live here in Columbia and work for the Department of Insurance.
Good morning. I'm Jared Tippins. I live in Florence, South Carolina, represent Congressional District Number 7, owner operator of retail community pharmacy, infusion, and compounding pharmacy.
Good morning. I'm Dottie Farfone. I represent District 1. I live in Charleston, South Carolina, and I work in independent specialty pharmacy.
I'm Carolyn Sutherland. I am advice counsel for the board.
Okay, so as you see, we have a full house today, so we do not have consideration of excuses for absences of board members. Next, we'll move to the approval of the board agenda. Is there a motion to adopt the agenda?
So moved.
A motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. All right, next up is the approval of the October 1st through 2nd, 2025 board minutes. Did the board have any edits to the minutes?
I'd like to make a motion to amend the minutes with regards to my statement that's recorded under the section about the proposed outsourcing facility regulations, specifically the part that addresses the point I was trying to make about the need for incorporating CGMP requirements into the regulation. I think that misrepresents what I was actually trying to say. Was just evaluating the impact of incorporating those requirements into regulation, and I just wanted to amend the wording there.
Okay, staff has that wording to update. Okay, so we have a friendly amendment. So I will now accept a motion to approve the board minutes as amended. Are there any, for the October 1st through 2nd board meeting? All those in favor say aye.
Aye.
Opposed? And the motion carries. Are there any edits to the called meeting on October 15th?
Motion to approve.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? And the motion carries. I would like to note that I really appreciate the hard work in the minutes. I know that there was a lot of transcript reading by staff and council, so really appreciate how y'all prepared those. So thank you. All right. Next up are chairman's remarks by me. I'm going to take this opportunity to give my remarks, but also give you an update from the recent NABP forum. So good morning, everyone. Thank you for being here. I wanted to use my opening remarks to share some of what I learned at the recent NABP forum, which gave me the opportunity to engage with presentations that really get to the heart of what it means to serve on a regulatory board today, balancing public protection, professional judgment, and the rapidly evolving healthcare landscape. I want to take a moment to reflect on a few key themes that stood out, especially around conflicts of interest and compounding practice, because they will speak directly to our responsibilities as a board member. One session I was eager to hear from was called Conflicts of Interest to Recuse or Not Recuse, led by Nicole Schuster. This presentation reminded us that a conflict of interest is not necessarily about wrongdoing. It's about recognizing when our own professional, personal, or financial relationships could compromise or even appear to compromise our judgment. Conflicts exist on a spectrum, and many of them live in gray areas. The gray area where good governance can falter, that gray area is where good governance can falter if we are not attentive. We were reminded that monitoring for conflicts is not something delegated to staff, legal counsel, or the board chair. The burden sits first and foremost with each of us as board members. That means paying attention not just to the agenda in front of us, but also to the shifts in our own personal or professional lives that may intersect with board matters. If we have a personal connection to a licensee, if we have outside employment that stands to benefit from our vote, or if there's any question about impartiality, those are situations that demand careful assessment. The presentation also clarified what recusal truly means. Recusal is not merely abstaining. It is removing your influence entirely. This includes stepping out of the deliberations, avoiding behind-the-scenes conversations, and ensuring that the recusal is clearly and properly documented. This protects not only the process, but our own credibility. Dr. Schuster made it clear, when in doubt, just disclose. When asked by a state official to consider recusing, take that request seriously. When a conflict cannot be resolved in a manner that preserves fairness, both actual and perceived, recusal is the right course. Failure to do so can bring real consequences: ethics opinions, penalties, removal from the board, and potentially even criminal liabilities. But just as importantly, it can undermine public trust in our board and force us to redo actions that should have been resolved correctly the first time. She shared case examples that personally scared me to death about the Alabama and North Carolina dental boards, and were powerful reminders of what happens when boards comprise of active market participants act without proper oversight or without identifying conflicts. Those situations showed us that misunderstanding our role or ignoring the optics of a conflict can expose a board not just to public scrutiny, but to antitrust risk and legal challenge. Ultimately, the takeaway was simple and essential: safeguarding the integrity of our decisions is part of how we safeguard public health. Another major theme from the forum centered on compounding, an intention that continues to demand our close attention. The compounding presentations, from regulatory requirements under 503A, 503B, USP 795 and 797, and real-world inspection findings, reinforce how essential compounding is to our health system, but also how vulnerable it can be when the standards aren't followed. We were reminded that compounding is often necessary for children, for patients with allergies, for non-commercially available medications, and during shortages. But that necessity does not lower the bar. It actually raises it. Compounding preparations must be safe, high quality, appropriate for use, and lawful. And lawful now carries a very specific meaning. If a facility does not meet the requirements under 503A or 503B, the preparations may not be exempt from the FDA, may no longer be exempt from the FDA drug approval requirements. In other words, the pharmacy is producing an unapproved drug. The forum also gave us some real-world examples. We saw facilities operating with insanitary conditions, issues with ventilation, cluttered environments, improper aseptic technique, a poor separation of sterile, non-sterile processes, and a lizard. These are not minor oversights. These are conditions that create direct patient risk. We also heard about a DEA inquiry into a compounded testosterone cream that was found to contain methamphetamine after the individual took a drug test. This was not as a contamination, but likely as an intentionally added substance. It was promoted to give energy. That example underscores why ingredient sourcing, documentation, and oversight must be ironclad. It's also why our board's role in enforcement and education is so critical. We also reviewed compliance trends as well, including data from NABP's Verified Pharmacy Program and the USP chapter revisions. Many pharmacies are still in the process of updating their master formulation records and compounding procedures. There was a lot of importance put on the comprehensive training, not just for compounders, but also for inspectors, where I noted how well trained our South Carolina inspectors are. NABP's efforts to expand sterile compounding training and strengthen inspection standards show a strong commitment to supporting states in this work. The overarching message from these sessions was that safe compounding demands rigor, rigorous facilities, rigorous processes, rigorous documentation, and rigorous oversight. And when all these elements are in place, the majority of compounding pharmacies are doing excellent work for our patients every day. Across the other presentations, discussing AI and pharmacy practice, continuing education as a tool to reduce repeat offenses by licensees, or changes in our national licensure examinations, one theme was constant: the importance of our role as regulators. The public relies on us to navigate the complex, evolving issues with fairness, transparency, and an unwavering commitment to safety. So I hope that we will be able to carry these lessons forward today in our future meetings. I hope to approach our work with clarity and good judgment and uphold the highest standards in all areas of pharmacy practice. Our decisions matter deeply to our profession, our communities, and most importantly, to the patients we serve. Thank you for that time today, and I will move on to number 7, Administrator's Report. Dr. Shealy.
So in your board book, you should have most of my report, just some things to highlight on there. For the executive report, the number of licenses and permits as of 11/14/2025 is pretty stable and consistent with what it has been. We are adding staff, so we hope to have a new inspector, a 5th inspector on staff onboarding in January. We also hope to have a new administrative assistant that will be starting in either December, likely January as well. So we are getting more staff and expanding our team. We're super excited about that. Meetings that our staff or board members attended listed there for you. You also have in your packet the communication that we received from the Alliance for Pharmacy Compounding with the request that it be shared with the board members, just kind of reiterating what is compounding, what is not, some of the conversation regarding a lot of GLP-1 stuff. So that is there. Our 4th district election ballots are out. I was asked to share who is on the ballot for those who may not be in that district, so you wouldn't receive the ballots. Kevin Cogstill, Raymond Westrick, and Tim Gentlecore, and I likely butchered some of their names, and I do apologize. That was not intentional. But those are the 3 individuals who are on the ballots for the 4th district. Those ballots must be postmarked by December 4th, and then once we receive them, we will set a date to count them, and then we send the results, if you will, to the governor's office. This particular seat is currently vacant due to a resignation. Statute says that the vacancy must be filled by the same manner in which the seat is normally filled, so via election. Once appointed by the governor, they could be appointed, this individual could be appointed to fill the vacancy and then continue serving. All of it just kind of depends on when the appointment and all of the other things happen. But the seat was up for election this current year too, so it's kind of an interesting situation where we have a vacancy that also would be up for election anyway. So timing, we'll just see how things happen and flow. Other things to add, thank you to all of you for supporting our staff during Pharmacy Week. We appreciated the meal. We also included our advice council in that, so just want to say thank you on behalf of staff. Thank you very much for that. Application renewals, pharmacist renewals will open February 1st. Those are online. Your online questions may look slightly different with ordering of questions, so that is just something to call your attention to. Also, please do not renew. You should not renew until you have met CE requirements. CE requirements for pharmacists are 15 hours a year, at least 7.5 are in drug therapy/patient management. All pharmacists must have an hour of continuing education for monitoring of controlled substance, that is per statute. If you immunize, an hour of CE for immunization practice, and if you dispense via the hormonal contraceptive pharmacy access protocol, an hour of contraceptive education is required as well. So that's just a kind of friendly reminder. It likely will come up later today as we talk about the CE audit. So just wanted to put that out there. Also, the exemption period for DSCSA for large dispensers, those are pharmacies that have more than 25 full-time employees. That exemption period ends 11/27 of this year, so Thanksgiving week. Small dispenser exemption period ends in 2026, so just wanted to call that to your attention. The other thing that is in your packet is the new pharmacy board member manual. So my predecessor started this manual. We have updated it, and I know that some of you probably have never seen it before because you were on the board prior to the development of this manual. So just wanted to share it with everyone so that you see what it's there. It has some good information. Your names have been updated. Our advice council has been updated. So any questions that you have about that, I'm happy to answer. Now,
Dr. Shealy, one, thank you for that in-depth report. Also, the board book is extremely helpful. One clarification, I saw in there the chair of legislative committee. Did we need to update that based off of disbanding?
Yeah,
Those committees?
thank you. I caught that as well. I have some minor, just like edits. If any of us have edits, do we just submit those to you?
yes, please.
Yeah. Okay, thank you. Other questions for our administrator? Yes, I would agree. Thank you very much for all your hard work on all of these reports and sharing of information. It is very much appreciated.
Moving to the finance report.
Please.
You should have financial reports from September, and we were able to upload October because it came out yesterday, actually. So all things are in good standing. I will just make you aware that our portion of some of the shared services will be increasing due to the new contract with RPP. And so our shared service portion, you'll see be higher than it has been in years past.
That unique to our board or kind of across the board?
It's across all the boards that use that service. So it's not just us.
Questions on the finance report? Okay, we will move on to the inspector's reports.
So I am actually going to present the inspector's report on behalf of the inspectors. We are trying some new things, a lot of new things this meeting. So just kind of across the board for all of the inspectors, they continue to see new permit request, so needing to go out for inspections of new facilities, or change of something. So statute requires a new permit be issued for change of name, change of location, depending on whether it's in the same city or not, same city, those sorts of things. So that requires a new inspection or an inspection of that location. And so they are seeing an increase in that. Some of our areas, particularly the Low Country, continue to see a number of practices doing IV hydration. We are getting a lot of questions in the office kind of related to that for mobile hydration services. So that's just to put on your radar. For the most part, people are in compliance. Some questions that our inspectors are getting pretty regularly in certain areas include USP 800 questions, how to handle that, what to do, will the board, adopt/enforce 800, et cetera. And then some other things, findings during inspection are related to issues with documentation. I think a couple of meetings ago, maybe last meeting, brought up the transfer documentation. So that continues to be a finding. So just making sure that people are aware of the documentation for transfers for both the receiving and the transferring pharmacy, just to be noted there. And then we are working to get pharmacies to have the updated or the full, if you will, immunization emergency kit for adverse events, and making sure that if you go immunize off-site, that the kit goes with you.
Thank you. Questions regarding the inspector's reports? I have one. So since USP 800 is about employee health and protection, does that fall under our purview, or is that an OSHA type thing? Or I don't know is.
I think it depends.
Thank you, attorney. And is that what we're
Ditto,
telling
Sheely.
licensees as well? Like, maybe it depends.
I think for the most part, the response is you should be aware of and prepare for in the future should our Board of Pharmacy say all people must be compliant with USP 800, just that sort of thing, the kind of what the purpose of it is and what it says.
Okay. Great, thank you. Next up, we have recovering professionals report.
So they have submitted a report. This is from the advisory committee. So that is in your docket or in your packet as well. A little bit later in new business, RPP will be presenting kind of an overview for our board because we have a variety of new board members. And so thought it would be helpful, but that is later on in new business. I do believe, I don't see them physically here right now, so I would advise to, they're here, outside. So we can do that now, or you can wait for new business.
Let's do that now, please.
I get the IT person to come sign me back in. I got out for some reason.
Stephanie's coming to help you.
Hello. Y'all can come right up to the front here. Good. See, I believe we'll have you go first. Thank you for coming today. I'll give you a second to set up. Y'all probably are aware, but these microphones are sensitive. You have to talk uncomfortably close to it and ensure that the red light is on the whole time. Ms. Cooper, I'll let you go first.
Good morning, board members and chairperson, Madam Chairperson. Tia Cooper, Program Director, South Carolina Recovering Professionals Program. I am here with our Medical Director, Dr. Rebecca Payne, and then also our General Counsel, Thomas Smith. And we know that there are many new faces with the Board of Pharmacy, but we wanted to come and introduce ourselves to you. We are the South Carolina Recovering Professionals Program. We are contracted by LRR to monitor licensed impaired healthcare professionals, not just for substance use disorders, but mental health disorders as well, to include other issues as well. We have been in existence for 25 years, so we are not new to this. We are new to you because there are new faces here, but we have been in existence for 25 years. SCRPP has been awarded a new 5-year contract, and you can advance the slide. We've been awarded a new 5-year contract with LRR as of July of this year. Initial term is 1 year with 4 one-year options to renew. We will request to appear before you for an update on the questionnaire preferences. And the questionnaire is actually a document that we would like to meet before you so that you can let us know what your preferences are in regards to how we handle your licensees. So we will prepare to do that next year in 2026, but want to give you a heads up that that questionnaire is on the way. Our service contract awarded in April 2020, it provided for behavioral monitoring in the absence of a use disorder to include mental health issues such as depression, anxiety, and job-related burnout. And primarily, we monitor 16 various boards, but our main boards are UAll, nursing, medical, pharmacy, dental, and veterinarian. Board of Nursing actually takes up about 75% of our participants. We have more nurses in our program than any other participants in our program. And the simple answer to that is because there are just simply more nurses in the state of South Carolina. We are comprised of 10 staff. Next slide. We are comprised of 10 staff. It's myself, it's the medical director, it's our general counsel, and we also have an office manager. And we have 6 recovering professional coordinators. That is a new title for them. Their previous name is recovery specialist, but we do have a new name change for them, recovering professional coordinators. So you will see that name in the documents as they are presented to you. With our new contract, we have been advertising for new positions. We've been afforded the opportunity to expand our staff because currently we have 403 participants, and we are continuing to grow with the participants. So we need help. So we are advertising for 2 recovering professional coordinators, 2 compliance coordinators, 1 data coordinator, and 1 paralegal. In advance, please. And the next slide just lets you know about our staff training. So all of us are certified or licensed in any capacity. We're licensed addictions counselors, certified addictions counselors. So of course we are LRADAC employees, and we are required by LRADAC to attend and take care of our certifications. So we included staff trainings in this as well. We also do outreach. Myself and Dr. Payne, we do go out to various schools like Presbyterian or Medical University of South Carolina, USC School of Pharmacy, and we do some outreach as well. These next few slides are slides that you actually receive every reporting period prior to a pharmacy board hearing, and we send these reports to you so that you are aware of how many pharmacy participants that are in our program. As you can see, 42% of the participants are currently in monitoring, and then 33% are in various other stages. We have 19 that are board referred and 5 that are voluntary. Next slide. All right, we do report to you the employment status of the pharmacy participants. As you can see, we have it broken down, how many that are voluntary and working in the field, how many that are voluntary and working out of the field because they voluntarily surrendered, or how many that are voluntary and they are active. Board referred, 5 that are active, and then out of the field, and all of the various other not working statuses. Next slide. We currently have 24 pharmacy participants in the program. We have 15 PharmDs. We have 7 registered pharmacists, and we have 2 pharm techs. Usually we do not have that many pharm techs, of course, because of, the lower earning potential. Because of the financial situation that is required with the monitoring requirements, usually pharmacy technicians do not stay in the program. Slide. Intakes this past quarter, we had 1 board referred PharmD, we had 1 board referred Pharm Tech, and we had 1 voluntary registered pharmacist. Next slide. This past quarter, we had 1 board referred PharmD that was discharged for noncompliance. That means that they were monitoring, they had a diagnosis, probably was recommended for a treatment, and then they decided that they did not want to adhere to any type of recommendations for monitoring. And then also we had 1 board referred pharm intern that was discharged for noncompliance. This past quarter, we did not have any positive tests, no positive toxicology tests for pharmacy participants. Okay, and reporting requirements. I would like to let you all know that generally how we report to you is whenever someone is referred to SCRPP, we have 2 types of participants. We have voluntary and we have board referred. So if we receive a referral from Ray Trotter that a PharmD has tested positive on a pre-employment drug test for cannabis use for cannabis, they are referred to us. We complete an intake appointment and we have them sign releases of information. We also have them complete initial toxicology tests to include a hair test and also to include a PEth test. And a PEth test is a blood test that tests for the presence of alcohol going back 2 to 4 weeks. So that is their initial toxicology. That is part of their intake process. We also staff the case, and then we also refer them for an evaluation. That evaluation will determine whether or not that participant meets criteria for a substance use disorder or an impairing mental health disorder. And if that is the case, then they are appropriate for monitoring in RPP for 5 years. Based on the diagnosis, that does depend on how long we will monitor them. So we report to you whenever they have completed their initial toxicology. We report to you whenever they have completed their evaluation. We report to you what the evaluation report is, the findings of that, and then we also report to you if there are any issues surrounding whether or not they do not want to adhere to monitoring in the program. In addition to that, we report to you safety to practice concerns. The Board of Nursing has instructed us that should we receive an evaluation that has a recommendation that someone is not safe to practice, we are to immediately report that to that board. So we have adopted that practice for every board. So as soon as we receive an evaluation and should it say that this person is not safe to practice, then we immediately report that to you. All participants do have the option to have a second opinion evaluation. Should they not agree to the findings of that initial evaluation, then they do have the option to have a second opinion evaluation. We will report that to you as well should they elect to have a second opinion evaluation. We also report to you successful completion We report to you if someone withdraw from the program. We report to you if someone has passed away. We do not report voluntary participants to you, and Dr. Payne will get into specifically in regards to the voluntary participants. We also have a weekly case tracker. That is something that has been implemented for about 2 years now. And what we do is report to you all of the active and board-referred pharmacy participants. And every week, we send that to you every Thursday. I send it to you on Thursday. Sometimes it'll be Friday morning, but most times it's on Thursdays. And of course, like I said, safety to practice advisories. At any time, if someone does not adhere to monitoring and they have tested positive, they have been deemed not safe to practice, we are reporting that to you. Okay. Pass it on to Dr. Payne.
Thank you, Ms. Cooper.
Thank you for being here. Oh, sorry. Am I mic'd? Okay. It is my understanding you may have some specific case information to share with us that may be pursuant to state and federal privacy laws?
Yeah, I am requesting that this next section be in a closed hearing.
Okay. I'll entertain a motion to go into closed session for this presentation.
So moves.
I have a motion and a second. All those in favor say aye.
Aye.
Opposed? As our guests come back in, if you would like to take a quick convenience break, you may. All right, thank you to our guests today for accommodating that closed session. And we are out of closed session and we are out of break, so thank you for that. We are going to go to item 8, Office of Investigations and Enforcement, Dr. Jennifer Harris. Thank you.
Good morning, everyone. So we're going to go over the IOC report. The first part of this report is the statistical report, and that is from January 1st of this year through November 4th. We have 99 active investigations, we have 211 closed cases, and then we have received, as of the 4th of November, 256 complaints.
Okay. I will now accept a motion to approve the.
I'll have to do that.
Not yet.
Not
No,
yet.
Sorry. This one's just for report,
Yes.
for notice. Thank you.
Okay. And then the next report we will need a motion on. We have 4 cases for dismissal, 3 for formal complaint, and 5 for letter of caution. Those were the recommendations from the IRC.
I will now accept a motion to approve the IRC recommendations with, or if there's any edits.
Motion to approve.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? And the motion carries. All good? Okay. Now we will go to item 9, Office of Disciplinary Counsel, Casey Smith.
Thank you. This is the statistical report, and this is for your information only. You currently have 39 open cases, 9 are pending hearings or agreements. We've closed 8 since the last report on September 17th, 2025, and we've closed 30 since January 1st, 2025.
Okay. We accept this ODC statistical report as information.
And then if you guys are ready, we'll go on to the consent agreements. And do you guys want to approve those as a whole or one by one?
Do the board members have any opinion on that? We will take those as one.
The first one for your consideration is case number 2023-71. This is a consent agreement under the resolution guidelines that includes a public reprimand and a $500 fine. And the facts are as follows, that this Minute Clinic was initially permitted by the board on July 29th, 2019. On March 28th, 2023, an LLR inspector conducted a routine inspection. During that inspection, it was noted that respondent had not required the consultant pharmacist to provide monthly inspection reports from February 2022 and from August 2022 through the inspection date, as well as multiple expired drugs found in active inventory. The complaint was filed in May of 2023, and the notice of complaint was sent in January 2024. The pharmacy manager submitted a statement of explanation and averments, specifically that Minute Clinic had closed in August of 2022 and remained closed through the LLR inspection date, and that the consultant pharmacist was unaware that it should continue to audit, and while it was closed, and incorrectly assumed the audit could be done prior to the clinic reopening to remove any expired drugs, verify refrigerators in working order, and remove any recalled drugs. The report due at the time of the inspection was submitted to the LLR inspector, and all monthly inspections since the inspection have consistently been completed and documented. Under this agreement, they admit that they violated South Carolina Code 4043-86C1C and C1F, and that they are a non-dispensing drug outlet permit holder and did not require the consultant pharmacist to remove expired drugs from active inventory, and did not require the consultant pharmacist to perform monthly written inspections that were readily available.
Motion to approve.
Second.
I have a motion and a second for this particular case, correct? All those in favor say aye.
Aye.
Opposed? The motion carries.
Thank you. The next one is 2023-136. This is a Minute Clinic, and it is a non-dispensing drug outlet permit. The board initially permitted the respondent on July 29th, 2019. The respondent admits the following, that on June 9th, 2023, an LLR inspector conducted a routine inspection, and during that inspection, it was noted that the respondent had not required the consultant pharmacist to perform required duties on monthly inspections, specifically missing reports from November 21 March 23, April 23, and May of 2023. And on November 8th, 2023, the pharmacy manager submitted a statement of policy changes moving forward, specifically stating that he will put reminders on his phone to ensure better monthly tracking, and then written monthly inspections are in compliance with all guidelines. In this, there's an admission that they violated South Carolina Code 4043-86C1F. As a non-dispensing drug outlet permit holder, they did not require the consultant pharmacist to perform monthly written inspections that were readily available, and this includes a public reprimand and a $500 fine.
Madam Chair, I make a recommendation or a motion to accept case 2023-136 consent agreement.
Okay, we have a motion. Do we have a second? Motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries.
Thank you. And the last one is 2025-2, Palmetto Transport Systems. This is a non-dispensing drug outlet permit that was first permitted by the board on June 29th, 2020. And under this agreement, the respondent admits the following: that their permit lapsed on July 1st, 2024, and was reinstated on January 2nd, 2025, and they continue to operate as a non-dispensing drug outlet with a lapsed permit. This is the second permit lapse for the respondent, with the first lapse being from July 1st, 2021 until October 8th, 2021. The respondent made the following admissions and averments: that there was a series of oversights that led to the lapsed permit from July 1st to 2024 to January 2nd, 2025, and further avers that since the permit lapse in question, they've made procedural changes regarding the renewal of all licenses and permits to ensure compliance. Under the agreement, there's an admission to violating South Carolina Code 4043-83A and 90D and operating with a lapsed permit. This includes a public reprimand and a $1,000 fine.
Madam Chair, in regards to case 2025-2, I make a motion that we accept the consent agreement.
We have a motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries.
Thank you. And just for the board's information, we had 3 cases under voluntary surrender: 2025-187, 203, and 224. And then 3 cases for relinquishment: 2025-27, 182, and 189.
We take those as information.
Yes.
Anything else for your report, Ms. Smith?
There is nothing else from ODC. Thank you.
Thank you. I will say it's unfortunate when we see these consultant pharmacists not doing inspections, but I suspect that it's because the clinic is closed and they're kind of unaware of their continued duties for that. So thank you. Those are not the first 2 we've seen. All right. Now on to other reports. First up, we have board member travel. So this is improperly labeled as a policy. This is not technically a policy. That is some old terminology that I had used at the time when I drafted it. And in fact, I think maybe the best place for this travel advice would be in our board manual that we just saw earlier from Dr. Shealy. So just as a high-level overview, that the State Board of Pharmacy does support participation by our board members in regional and national professional meetings that advance the mission of the board. It provides opportunities for education, collaboration, and the sharing of best practices that strengthen pharmacy regulation and protect public health. This is funded through taxpayer funding, so I want us to be wise stewards of that. So just, and this is, I'm bringing this up not as anyone has violated this, but just to clear up expectations and that we have that we all kind of agree upon. That when you attend these meetings, there's active participation, there's a recap and a reporting when you return. I know that a lot of these meetings we would all like to go to. Financially and logistically, that's difficult. So I appreciate when there's recaps and reporting coming back. Appropriate use of travel, that you're using it for board business, not conducting personal, private, or outside business interests, and then any compliance with travel rules through the state agency. So would we need a motion to put this in the manual, or can we just take this as information? If you feel like there's any edits or additions you would like to add to this, please submit that to Dr. Shealy as well for inclusion in our manual. Thank you for that. All right, so speaking of, we have had a lot of member engagement from South Carolina in NABP task forces. This is the most I believe I've ever seen, so that's wonderful. I appreciate your willingness to participate at the national level. Ms. Black, I know you had a recent participation. If you have anything to share, I'd love to hear it.
I do, because I wasn't here last time, and so I'd like to do a brief recap. In addition, the minutes have come out. I was privileged to serve on a task force to review increasing access to medications for OUD that met September 15th and 16th in Mount Prospect, Illinois. It was pursuant to a House of Delegates recommendation, and it was designed to look at access issues caused by illegal settlement and how people are having a very difficult time getting appropriate dosage of buprenorphine depending upon their location, their needs, et cetera. So we spent 2 days reviewing that. The basic recommendations were that a new policy was developed to increase access, to pull together a larger group of people, including major pharmacy associations and other pertinent people involved in thought processes, and then potential changes in the Model Practice Act. It's the first time I've had an opportunity to participate, and it was a very group task force, and it worked out very well, and we came up with some very meaty I have a copy of the minutes if anyone would like to see them.
Thank you, Ms. Black. Appreciate that. Dr. Farfone, I think you also participated recently this fall.
I had another meeting since our last meeting that I reported on, so.
Great, thank you. And Dr. Spagner.
Thank you. So based off of the recommendations not having come out yet, the confidentiality agreement, I was told is still in place. So the task force charge was to evaluate current requirements for Pharmacy Graduate Examination Committee, or FPGEC, certification, review the use of the test of English as a foreign language internet-based test, or TOEFL IBT, exam as a requirement for the FPGEC certification, and recommend any changes, if any, to the use of TOEFL for the FPGEC certification. I can say it was a lively discussion. There was some phenomenal perspectives, most of which that I had not even considered previously. So I look forward to those recommendations being published corporately. Yep.
Wonderful, thank you. All right, I will move on to item 10C, the South Carolina Department of Public Health Bureau of Drug Control.
So, Madam Chair, there is no one here today from there in an effort to try to be more collaborative with all of our agencies in the state. I have invited members to attend whenever they have an update to share with us and just be present. They were not able to attend this meeting, but they do have the 2026 dates, and we'll make a plan to attend a future meeting.
That would be great, thank you. Okay, item 10D, Drug Enforcement Agency.
We do have a representative here today. Does not have a report to share as far as an update, but if he would like to introduce himself, just so that you guys are aware.
Thank you. If you'll just come to that microphone and just make sure to talk right into it.
Morning, I'm James Osborne. I'm a diversion investigator with DEA out of Columbia. I appreciate the opportunity to be here today, but as she stated,
Thank you. Well, we certainly appreciate your work in the field and everything you're doing, and hope to continue to have conversations and work in the future.
likewise,
Thank you. All right, 10E, report from associations. Number 1, South Carolina Hospital Association.
So each of the associations that are in item E did submit a report at the request of the board, so that is in your board book, but each also has representatives here to speak to their report and answer any clarifying questions that the board might have. SEHA actually has 2 people here today.
Yeah, if you don't mind introducing yourself, that'd be wonderful. Thank you.
Good morning. I'm Laura Hewitt, and I work with the South Carolina Hospital Association. Thank you all for having us here today. I also have one of our board members, Jennifer Baer, who's the Chief Pharmacy Officer for Prisma Health. So we're happy to, if you have any questions about the report, or at a high level, I can run through it, not read it to you, because I know you do have a copy of that. And Jennifer's here to provide any additional commentary or context about how some of the issues that we're following or that we are concerned about, the impact that that has on hospital operations and pharmacy, overall hospital pharmacy operations.
Thank you for that. I'll take questions from board members on that report. I can say recently at the NABP forum, these are issues across lots of states. So sometimes it's nice to know you're not alone, but I'm sure that it's a lot to work with.
Yes, and we're happy to provide any support to the board or learn from the board, cooperate with the board on any of these issues. But 340B is a big one for our hospitals. Not all hospitals be eligible, obviously, but there is a significant percentage in the state. And for them, the impact of 340B losses is significant. So it's a big issue for us. We're both tracking what's happening at the federal level in the efforts to reform it or take it away completely, but also at the state level and looking at similar legislation to what other states have done regarding manufacturers' restrictions. We're partnering with several other groups in the state, including the Pharmacy Association, the Society of Health System Pharmacists, and the Primary Healthcare Association, because this also impacts all of the health centers around the state. These other issues that we've referenced as well, the collaborative practice agreement. In my role at the Hospital Association, I spend all of my time pretty much focused on the healthcare workforce and trying to figure out how do we get more and how do we grow it. And so one of the things that we're always looking at is, are there things within the scopes that we can change to allow for more flexibility of the workforce so that we can get it out into the places where we need to be able to meet the needs of patients. So SCSHP also asked us for support, and that's in line with our overall framework and our overall goals as well. And then the last biggest issue is the hospital representation on this board. So we've been working to try to get some individuals to submit their names through the election process, and they have done so. So that we can have a practicing hospital pharmacist representation back on this board. So we hope to see that. And I'll turn to Jennifer for any additional context or comments about how some of these issues impact overall hospital operations.
Thank you, Laura, and I appreciate the time to be with you guys this morning. I think the only additional thing I'll add is the importance of educating about 340B as it affects hospitals that and health systems who are covered entities, and there are multiple ways by which they become covered entities. But I think it's also important to those who practice in the community in retail and community pharmacies and the ability to become contract pharmacies and extend access to patients. Rural areas and the areas that a lot of our health systems cover. And so I think the education is really important around 340B and its ability to extend access in the health system and in areas where fill those prescriptions. Am I not getting close enough?
Pull it to you, like
Okay.
uncomfortably close there.
Okay. Oh, yeah, it is. Okay. So, I would love to work with the appropriate stakeholders around education of that to make sure that everybody really understands the issue around 340B, as it's not really just a health system issue, as it extends to community pharmacies and retail pharmacies with whom we can contract to extend access for our patients across the state. So I really hope that we can continue to do that and work with you guys in that way.
Okay, thank you for that. Questions?
Just a general question. What percentage of hospitals in the state of South Carolina participate currently in 340?
The number of covered entities, I would be guessing right now, but I can get the exact number and follow up with you guys, is probably around 50 to 60%. But I'll follow up with an exact number. Yep.
I don't have a question. Just thank you for the information, for your partnership, and we look forward to the efforts, fruits of your efforts.
Thank you very much.
Okay, wonderful. Thank you for that and for being here. I will move on to 10E2, the South Carolina Pharmacy Association.
Brian Clark, CEO, is here to speak.
Wonderful. That report is also included in here, so I will entertain any questions for him.
If the board wishes, he could also provide upcoming events that might provide continuing education or some
That sounds great. Thank you. I would love to hear
for
those.
that if he has it.
Thank you for the opportunity to be here again for you today. The partnership, the upcoming events that we have, our next board meeting is December the 2nd. We will have a continuing education event. It's the 20th version of the Southeastern Leadership Weekend. That will be in Asheville, January 16th through 18th, Omni Grove Park Inn. We'll be offering 10 hours of CE. One of the key that will be speaking there will be Kate Gaynor, who is my former counterpart from Iowa. As you probably are aware, she was very instrumental in standard of care and getting that passed. So we're looking forward. She actually is doing 2 sessions with us there. Very fortunate for the partnership that we have and for her to be able to be here be there with us. Our next All Pharmacy Conference is February the 3rd. Really would like participation. That's all things pharmacy. That is not associated with education, but we would love to have board representation there. Our House of Delegates is February the 15th. Have continuing education 2 hours coming up, spring pharmacy nights. One of those will be on an update of all things SCPHA. In April, we will have 4 hours of continuing education tailored to pharmacy technicians. That's our annual Tech Connect program. And then finally, actually spring pharmacy night will be coming up in March. So annual convention, we're very pleased to announce it's our 150th anniversary. Annual convention dates are July the 9th to the 12th. That will be in Hilton. Very much love to have participation from the Board of Pharmacy at that convention. Happy to answer any questions you guys have for.
You said 150th?
Yep,
That's amazing.
150th, 1876, March the 10th, to be specific.
Interesting. Questions? Oh, go ahead.
Just comment, Brian, to you too for your leadership, advocacy, association, delegation, advocacy with the other associations in the room. Really appreciate that leadership, and again, look forward to fruits of y'all's labor as well, because you got a lot of bills that potentially could impact the profession as a whole. So thank you for the work.
Thank you. I did want to acknowledge the 340B issue and that we are having quarterly meetings with SCSHP, some leadership from them. Our biggest concern right now is that we're not siloed, and when we're advocating right now is our priorities are based upon elections by the board annually, and PBM reform is number 1 at the top of that list, that we're not undoing work of each other. And so we are working with them to put together a one-pager on 340B and a one-pager on PBM reform so that each group is at least well-versed when we go speak to these legislators, because I don't think it'll do us any good as pharmacists to go in and advocate on one thing and get questions on the other. It completely undoes all the work that either group is doing, and we need to work together to achieve success.
Other questions for Brian? All right, thank you.
Made it
Your
easy.
report
Thank
is
you.
received. Yes, thank you. I will take 10E3, South Carolina Society of Health System Pharmacists.
So they also submitted a report, and Harry was trying to have someone here to speak to it, but there is actually, speaking of 340B, a full-day 340B collaboration meeting that they also were attending, and they weren't sure if they would be able to make it work. Jennifer Bayer, though, is able to answer some questions.
Welcome back.
I will be happy to speak to this one, as I sit on the SCSHP board as well. So happy to answer any questions. I will speak to that. We have the annual meeting March 11th through 13th in Kiowa. So if you would like to move from, we would love the board support there. So if you'd like to move from Hilton Head to Kiowa, we would love to have the board there. As Brian mentioned, the inter-association collaboration is really important. So just to that as our initiatives align very much. And as Laura mentioned, the work with the Hospital Association and SCSHP around the important items of hospital representation or health system representation on this board, as well as compounding and making sure that we address as a board safe compounding in the state, as well as access for patients in the state, as we know those are the two important issues. And so I just wanted to highlight those things from this report, and then I'll be happy to answer any questions as submitted from the board.
Thank you. Questions for Jennifer Baer?
Out of curiosity, just because I'm not in your day-to-day world, the difference between SCHA and SCSHP in terms of, a lot of them, to your point, do look familiar or similar in terms of y'all's efforts and look forward to those fruits as well. But what's the difference?
Between the South Carolina
The
Hospital
association, yeah,
Association. The South Carolina Hospital Association is focused on all things hospital and not just pharmacy specific.
Okay.
And then the SCSHP is pharmacy specific. Does that help?
It does, yes, ma'am.
So SCHA would have physicians, medical directors, things
Yeah,
like that.
supply chain, all, all things related to pharmacy operation, hospital operations rather, yeah.
Got it.
But, pharmacy is such an important part of hospital and health systems that I just joined that board this year in recognition of how important pharmacy is to hospital and health systems.
Okay, hearing no questions, we will conclude those reports. Really appreciate y'all coming in today and for sharing your information.
Thank you.
Okay, I am going to use chair privilege and go to 12A, New Business Regulatory Landscape Overview, Holly Beeson, Communications and Governmental Affairs here at LLR. Holly, I believe you know the drill, but close and personal to the mic.
Am I on now? Yes.
All right,
Okay.
thank you.
Good morning. For those of you I may not have met before, I am Holly Beeson. I am the attorney in our Office of Communications and Governmental Affairs. One of my duties at LLR is to basically be the shepherd who takes the regulations that boards or our agency divisions promulgate through the Administrative Procedures Act requirements. And so that starts when you all have a board vote on a regulation. At that point, it's given to me, and I begin the publication process through the State Register, which, if you've never looked at it, it's on the State House website. It's published every fourth Friday of the month, and it contains anything we do related to regulations before they go to the General Assembly, along with a lot of other interim guidance that is given out by government agencies. For instance, if the governor issues an executive order or an emergency order, it will be in there as well. Other agencies' regulations or drafting notices are there. So it's a document full of interesting information. But anything we do related to your regulations, we take to Legislative Council, and it's published in the State Register. So for you all, I had published a notice of drafting related to your regulations, and then in October, we published the proposed regulations that you all voted on. Right now, they are in a comment period. That gives the public an opportunity to review them and to send you all any comments they may have. Also, along with that comment period, gives certain individuals or entities an opportunity to request a hearing before the Administrative Law Court on two factors, and it would be the reasonableness or the necessity of the regulation. These hearings are rare for our boards. I've only seen one since I've been here, but that doesn't mean we couldn't have one. In the event that we did, it has been set for, I believe the date is December 16th, but I can go ahead and I will go back and check. But in that instance, basically, we would be the board staff, and any individuals who would be testifying would appear before administrative law judge and simply explain why these regulations are being proposed, why they're reasonable in their scope, in their breadth, and why they're necessary. And usually that's a component of public health and safety. Assuming that we get a ruling from the judge, we will then, in a timely manner, we would then take the regulation to the General Assembly in January. The judge's ruling doesn't say whether you can or can't proceed. That's not the job of the administrative judge. The judge looks at the evidence and issues the report stating his or her belief as to the need and reasonableness. And then it becomes a report that is attached to the regulation when it goes to the General Assembly. So it's additional guidance for the members should they, choose to review that. At that point, it's a regulation, it's downtown, it will do what all of our regulations do. They run a little bit differently from bills. Bills run on one side and then cross over to the other side. Regulations go to both sides at the same time. You will have a Senate subcommittee hearing where evidence will be taken, testimony will be taken. At the same time, you will also have a House hearing, subcommittee hearing, where evidence is taken. If your regulation proceeds through those subcommittees, then it goes to the full committees of those same groups. So you'll just have more members of the same group. On the Senate side, that's Medical Affairs, the Medical Affairs Committee. On the House side, it's the Regulations and Administrative Procedures Committee. That committee has a new and longer name that I have not committed to memory yet. It involves AI, so the next time I speak to you, maybe I will know it. But it is the same group of people doing the same things plus more. If the regulation proceeds through both of those committees, subs and full on both sides, if there are no changes made, then it simply remains on the calendar until the 110th day arrives. At that point, it will go into effect by expiration of the 110-day approval period. Now, other things can happen along the way. The members could hear from other entities who disagree with the regulation as written. If they do, if they take a vote and agree that they would like for the board to make a change, then they will ask you all to make a change to the regulation, the proposed regulation that you've presented. That would come back to you for a board vote. We don't make changes without your buy-in. If you agree to the change, then we would withdraw the regulation and resubmit it with that change, and it would continue moving toward that 110-day approval period. If you disagreed with the change, then at that point, the regulation is halted. The choice we would have would be you could withdraw it and just not go forward at all that year. If you refuse to change, then likely the members would file a joint resolution to disapprove the regulation. So fortunately, we don't find ourselves in that position very often, but those are the options for how things could proceed. The important takeaway, though, is that if they ask us to make changes, we will come to you. We will ask for a special meeting so that you all get to discuss it. You understand what the request is being made of you, and you get to take that vote. That's a process discussion as far as regulations. A bigger regulatory landscape discussion, though, I can give you is looking at where we are right now. We are ending 2025. 2025 was the first of a 2-year legislative session. Every legislative session is 2 years, and so we will be heading into 2026. That will be their second year. So what they will have on the books to look at are bills that were filed and did not pass in 2025. They will have any pre-files that either come from the Senate or the House of Representatives in December. They each get a pre-filing date. And then any new bills that they choose to file any legislative day of 2026. So that means they have a lot on their plate. Also, because it's the second of the two-year session, if their bills don't pass at the end of May or the second Thursday in May, then they will die. And what that means is all of the work they have put in their bills is gone. They can refile them in 2027, but they lose all that progress. So they have a vested interest in focusing on these bills. Why does that matter to you? Because we live in the land of regulations. It matters because two of their bills are regulation-specific type bills. Every year since I've been here, there's always been a discussion in the General Assembly about reducing regulation. And that's generally a bipartisan topic. Everybody wants to reduce the footprint of government. Everybody wants to make it easier to do business, to limit government's involvement in their lives to just what's necessary to ensure health and safety. That's where we are. How you go about doing it, though, is different for most every member down there, what the best approach is. And so this year, we've got two different bills out there that spell out two different approaches, and they're still on the calendar. Neither one of them passed, but both of them passed their bodies. So on the House side, you have House Bill 3021, and I believe their name for that was Regulatory Freedom Act. But that is the bill that would basically sunset all existing regulations over a period of time and require all government agencies to repromulgate any regulations that they want to keep on the books. Repromulgating them will be a lot like what we do now, but it adds additional requirements for us. One of those is we have to provide an assessment report that will show that the benefit of the regulation outweighs the burden, and typically they're looking for data. It has to be a data-driven decision. And if you have looked at regulations, and I know you have, you probably know these are not really quantified by data. They're things that have been there for a long time because we know that they're necessary to protect the public health and safety. And so this will be a lift on our end to figure out how we go about satisfying the requirements of this bill should it pass. But of course, that is what we will be prepared to do should it pass. There are other aspects of that bill. The Small Business Regulatory Review Committee, which you may have never interacted with, is a committee, I believe it's appointed by the governor, but they review all agency regulations that are promulgated each year to determine what impact they have on business. They have meetings, they're public meetings. Sometimes they call on us to talk to them about their regulations. We go, we explain, we educate. This group will be called upon to review all regulations and make a recommendation to the General Assembly as to whether they should be reauthorized. They will also be doing this with an eye toward reducing overall regulation by 25%. So that's another aspect of this bill. There's one more aspect of this bill built into the timelines as far as like repromulgating all of our regulations. If we are to add new regulations, we would also have to recommend 2 to repeal. So for every one, we would suggest 2 that would need to go away. So it's just a whole different framework of how we would go about promulgating regulations. My understanding is that this is mirrored on legislation that has passed in other jurisdictions. We hear that it works. So we would just figure out how we had to go about it and make it work for our state, which we would do. On the other side, though, we have a very different bill. It's a government efficiency bill, and it's in the Senate. The House bill passed the House, the Senate bill passed the Senate, and so we're waiting to see what's going to happen with them both. The Senate bill, like I said, government efficiency is a term that, came around with basically with the new federal administration. It came to the state as well, and so this bill proposes creating a committee. 3 members would be appointed by the Senate, 3 appointed by the House, 3 appointed by the governor. And they would be looking more generally at regulations. I think they probably would solicit input from industry stakeholders and try to look at how or where the problems are, what needs to be reduced. They are focusing on it from both an individual's perspective and a business's perspective. They would also look at deregulation. Are there agencies, are there public bodies that are not necessary? That's another component of this bill. So they look at maybe a wider scope, but in a less detailed, specific procedural scope than the House bill. So that's the landscape of anything that we're doing today. We think about, if this passes, we may find ourselves passing this regulation that you put forward for 2026 again in 3 years, or again in 8 years, or whichever timeline it gets caught up in. The other thing that I would say is you're also working on something more permanent. This regulation, if it passes, is preserving the status quo until you get something more specific in place. That would probably come up in 2027. So you're looking at that landscape. What is that going to look like? It's going to look a lot like 2026, in my opinion, but you will have also had an election year in 26. So you may have new members, members who have also been considering regulatory reform, reducing regulation. So if you're looking at something more permanent in 2027, you're going to be possibly presenting that to people who have not dealt with regulations before. My thought would be something smaller, something maybe not as many pages, something that may not overwhelm them, but also something that they can look at. It's a difficult balance. I think about this particular regulation. I know the USP has compounding standards. So you could go from a very small perspective of incorporating by reference, but then you have members who wouldn't know what the USP says, and so that's going to be an educational component for us. The flip side of that is if you adopted the language from the USP, either wholesale or with tweaks, with changes, it may come in the form of 70 pages. And so you're looking at the new member who's never seen regulations, who might see 70 pages and be overwhelmed by that. So those are the perspectives I would try to give you when you're writing. You're thinking, who is my audience here? Your audience is always the public. But to get it to the public and to get it into effect, we go through the members first. And so when you're writing, think about the member who's not a pharmacist, possibly is a new member who hasn't dealt with regulations before and is coming in with a mindset of reducing regulation. I don't know if that is helpful for you. That's the landscape as I see it, but I can answer any questions, or I can go beyond that, whatever you'd like me to do.
Thank you very much for that report. I will open this up to board members.
I have put them all to sleep.
I just wanted to say that was very helpful. Say thank you for being here, because I think that's been part of the conversation that's been missed, maybe, of like, we know what we want to accomplish, but it isn't just to the audience. Like, we need to know our audience and how to get it pushed over the finish line. So I think that was helpful.
Thank you.
You had mentioned 70 pages is probably overwhelming. I know there are a lot of regulations that are up for consideration, so what's the recommendation? Like how many pages is a normal regulation that's put forth?
That's a great question. Oftentimes, I think of the ones that I have this year. I have several boards that are promulgating regulations. Some of them are doing cleanups on their entire regulations, so that might be 23 pages long. And there are little changes all throughout. The difference there is it is an existing regulation that's being tweaked. It's not completely new information. The last time I can think of that we did something brand new, even then, I think we were adopting an existing form, so I'm not sure I've seen anything new lately. I did talk to the folks at Legislative Council when this was trending early on. It was looking like we may be going the route of a lot of pages, and they reminded me that we're not the only agency that has a lot of regulations, and that some of them are long. When DHEC was an entity that was still together, they were probably our fellow sister state agency when it came to having the longer, more detailed regulations, and they certainly got them passed. So it's not that it's impossible. It's just that I think it will require more explanation on the front end. It will definitely require people, board members preferably, who have experience in compounding to come and testify and explain why we have to be as specific as we are being, why it has to be that detailed. That is about the best answer I can give. It's not a great one.
Is there some advantage that we have that we were tasked with promulgating this regulation and it just didn't come from us wanting to regulate more, but it was actually a task from the members?
And the other thing that you have available to you is the way that this looked when it was parked in your Practice Act. If you pull it back out, you could probably get a page number on that and figure out how many pages there were then. Your I guess, communication at that point is, here is what we had before. It was passed by the General Assembly in 2015 or 2016. This law required us to remove it and put it in regulation, so at a minimum, we need this back. But we do need to do what we have said needs to be done, which is update it, make it more current, make it applicable to 2025 standards.
Is there, when we submit a reg, is there like a background, like where you can put that information?
There is.
Okay.
We write I forget if it's statement of rationale, and we also are the people who begin the conversation of reasonableness and necessity. So we point all of that out, and that includes the history. So that is available to us as well.
Sort of a related question, because I'm the public representative on this board. In addition to what Rebecca pointed out about being asked to do this through the legislative process, is there any benefit to our making the point that a lot of these regulations are primarily focused on optimal public safety? And that doesn't mean that we're the only ones who do that. I realize there are a raft of other entities that do this. But is that helpful? And we certainly don't want to insult legislators, but just to remind them that these are patients and very complex.
Right. And you're exactly right. You know, the mission of the agency is protecting the health and safety, and that that stems to all the boards. And so that is always going to be the backbone, and that is the tie-in that we would make. The other thing in this situation that we would do whenever we do find ourselves testifying on these regulations is, talking about the history of compounding and what happens when there are compounding errors. That was, when I first got here, I think I'd been here for like 6 months when the one up in New England, I can't remember the name of it, but it was significant, it was widespread, and that it kind of spells out why we take this as seriously as we do. And I know they are receptive to that as well. That's, they struggle, the members struggle with recognizing that they want to protect the health and safety, but then looking at something this detailed and saying, are we overburdening? Are we going too far? And with the exception of Senator Cromer, we have no other pharmacists. We did it for a while. We had Representative Spires, but we have no other pharmacists available to be able to have that personal perspective that they can share. So it really falls back on us. And when I say us, I mean you as the subject matter experts to be that educator for the members.
Other questions for Holly?
You have to be invited to testify in regards to something like this, or are there other educational opportunities if you have something in the pipeline? I just don't, how do you get in front of people to talk to them about that?
Well, in the subcommittees, what they will do, that's our primary mechanism. And what they'll do about a week or two before they have a hearing, they will send out notice and they will put this regulation on there. And once we know about it, we will reach out to you all to share with you and invite you to testify. Usually at the very beginning of the year, staff of the committees will reach out to us and say, we'd like to just hear the highlights of what you have going forward this year so we know what's going to be in front of us. Because staff can see it in the register, but they don't know the background necessarily. So we typically meet with them and just hit the highlights. If staff knows a member has a question and wants to hear from us, we will reach out to that member and ask to speak to them. We could pair you up with that member if anyone has any question. What we don't do is lobby. We always say we educate, not advocate. Regulations are a little bit different, though, because they are coming from you, whereas legislation is coming from the members. And so that's where you don't oppose or support, but you necessarily support your regulation because you're putting it forward. So it does give you more of a chance to explain why you are supporting promulgating this regulation. So that's usually where we see it. Sometimes it's once it gets to the committee and the testimony is put forward, that's usually when we start hearing the questions back, though.
To add to that, Dr. Eunice, oftentimes what happens is that Holly and her team will send an email to the board executive and advice council letting us know that the subcommittees will be having a hearing and that representatives from the board will be requested to appear on whatever particular date, and then that's the invitation.
Other questions? Okay, hearing none, thank you so much for your time today and preparing that. We really appreciate that. All right, I will get back on schedule with 11A, Old Business Compounding Advisory Panel.
So at the called meeting in October, we were tasked with putting out a call for interested parties to serve on a compounding advisory panel. That would be 9 members, 8 pharmacists, 1 technician, and they would be appointed to serve a 1-year term with the expectation of attending in-person / virtual meetings to really provide advice to the board on proposed drafts of compounding regulations that the board will be doing. So I gave you kind of an update of timeline where we are as of 11/14. So the material or the information that was sent out in the e-blast and posted on the website per the board's decisions made at that called meeting are there for you, just so that to remind you of what you said we were looking for. So we got 33 pharmacist applications, if you will, 8 pharmacy technicians, and it was a pretty good mix for technicians of state certified versus just registered technicians. Staff and I began reviewing those soon after we received them. We have selected, if you will, 9 individuals. We have not notified them yet and invited them to accept this invitation to serve on the panel. That is something that we'll be doing this week and beginning of next week. My proposal is that the 1-year term start January 1st and go through December 31st, given that we don't have a draft for them to speak to in December. So I'd rather capitalize that 1-year term in January, and that we ask those individuals to come to the January meeting is kind of what I'm planning to do and handle from here. So any questions about?
Questions from board members regarding the panel? I think that's a great response. 41 is terrific. So I know that's a lot of work for y'all to go through, and I really appreciate that y'all did that quickly since 11/3 with preparing for the board meeting as well. So very much appreciated. And I am also in favor of going January 1st, 2026 through 12/31/26. All in agreement of that? I can make that, or someone can make that a motion if we need it.
I don't believe it has to be a motion. We already have a 1-year commitment. I think we just need to, yeah, we could confirm that. If you'd like to make it a motion, you certainly can, but it is a 1-year commitment that was requested and that weren't.
I wanted to ask a question. So they would be asked to come to the January meeting, and at that point, we would officially task them with what the objectives are, or would they already have that information?
So great question. My plan, based on the directives that I have from you guys, is that part of the invitation will include, here is your task as serving on this panel. Would invite you to attend in the January board meeting because per the chair's request, we will have a standing compounding regulation standing item on agendas moving forward until those regulations are drafted, so that the plan would be we would have a portion of a draft for this group to review, and I think that's going to be more discussed later on in this meeting, the process. So
Maybe I'll hold my questions for that discussion.
Okay, moving on. We have accomplished 12A, new business. Have we also accomplished 12B, recovering professionals? Did they have anything additional? Okay, we're good. All right, I will move on to 12C, approve CE audit failure, administrative suspension, and/or consent agreement parameters.
hopefully you're aware, statute requires us to do a 10% audit for CE every renewal year. We wait to start that process approximately 60 days after the respective license would have expired to give time for any CEs that would have been completed prior to the expiration to be uploaded to CPE Monitor, although we know that we accept other CE that would not be uploaded to CPE Monitor. So with that, also, we have, whenever I started, January 2nd, there was a board newsletter article that was put together, published in the first offering of the newsletter that speaks to the CE audit process. So I'll just read that for you. This is what I came in understanding that we would be doing. Says that if you do not complete the required CE, you are subject to administrative suspension of your license. In certain circumstances, you may be afforded the option of signing a consent agreement to assist you in obtaining the necessary qualifications to resume practice without administrative suspension. The consent agreement typically includes providing documentation of 15 hours of CE to cover the previous licensure period, so a total of 30 hours for the next renewal period. Taking the board's reciprocity course, which would be the interviews that each of you attends once now, thank you, and being assessed a $250 fine and receiving a public reprimand that is reported to the National Practitioner Data Bank. That is my understanding that the board had wanted to do. Also in November of '24, the board approved a one-time administrative suspension process that did not include a consent agreement as part of that. So I am here asking for affirmation/clarity on what you would like for us to do with CE audit failures, because we are in the midst of that right now. Specifically, what are the certain circumstances where one may be afforded a consent agreement if you wish for that to be what is done? I can provide numbers, just numbers, not specifics, obviously, but numbers, further information if you wish.
Casey, I do think it would be valuable if you provided the numbers and then sort of like scenarios, like the different fact patterns that are generally seen.
So in the audit for pharmacists, so we are currently have collected all of the pharmacist audit because that's the first license that expires. The renewal year or renewal time period for pharmacists is May 1st to April 30th. That's the license year, I should say. We audited 879 pharmacists, which would be 10% of the licensees. Of those, there are 54 failures, which includes 6 non-responders. Most of the failures, if you will, are because of due to lacking a specific continuing education for controlled substance monitoring. A couple of individuals marked that they immunize on their renewal application, but could not provide evidence of having immunization CE. A couple of individuals marked that they dispense via the pharmacy access protocol, contraceptive dispensing, without needing a patient-specific order from another provider, but could not provide the specific CE required for contraceptive medications as the statute requires. And then only a handful of individuals had 0 to 1 hour of CE or did not respond to provide any evidence of CE.
And for clarification for me and board members and the public, when we're looking at these categories such as contraceptive care or controlled substances, those don't always have ACPE codes. And so can you clarify for us kind of how you discern that it is in that category?
Absolutely. So this is my first personal experience on this side of it, so I can just tell you what I have experienced firsthand now. With the audit, we send a list of audited pharmacists, if you will, audited licensees to NABP so that they can send us back a secured spreadsheet of those licensees, all of the CE that are captured within a given time period, which would be, again, the licensure period, all of the CE that are uploaded to that person's CPE monitor. that is our first round. We look at that, look to see that everyone has the hours that they need per statute, half of them being patient care, patient management / drug therapy, and then controlled substance monitoring. Some of those are easier to identify based on the ACPE code, based on how the accrediting provider would put those forward for ACPE. Like drug therapy management is easy, it's 01. Other ones like controlled substances, the information we get back from NABP includes raw data, which is the title of the CE. So in that first round, we look at the titles of those to see, does it mention controlled substances? Does it mention specific controlled substances, opioid use, things like that? We are more broad in the accepting of CE that would in our mind, account for that controlled substance monitoring. So that is first round. If we are not able to get all of the information and check people off, if you will, with that first pass, then we reach out to those individuals and ask for them to send us their education. Not all CE that we can accept per statute is uploaded to a CPE monitor, because we also accept what was previously known as CME Category 1. It is now AMA PRA Category 1. So we do accept that. Those are not uploaded to CPE monitor. So whenever we reach out to licensees, because we are not able to check them off by ourselves, then the opportunity for them to submit all of that to us, and we use whatever they submit and try to make those determinations. Then we reach out again. Sometimes they don't respond that second time, so we reach out again. I can get with staff, they have at least reached out 4 times via email and sent at least one certified letter requesting information from individuals at this point. But we try to do as much as we can without having the licensee send us information, just based on the data we have available. Does that?
It sure did. Other questions?
Go over what was in the newsletter. I mean, I'm just wondering if that's something we need to put. I know our next agenda item is resolution guidelines. Does that need to become part of our resolution guidelines so that we have it documented?
I would be in favor of that clarity if the board so chooses.
Okay, so do you mind reading again what was in the newsletter?
I will be happy to.
Okay.
And I can also upload it if y'all want to your board material so you have it, or I can print it and provide it, because you likely will have some conversations. My guess is in executive session. So it says, if you did not complete the required CE, you are subject to administrative suspension of your license. In certain circumstances, you may be afforded the option of signing a consent agreement to assist you in obtaining the necessary qualifications to resume practice without administrative suspension. The consent agreement typically includes providing documentation of 15 hours of CE to cover the previous licensure period, so a total of 30 hours for the next renewal period, taking the board's reciprocity course, being assessed a $250 fine, and receiving a public reprimand that is reported to the National Practitioner Data Bank.
And I just want to put on the record, these are professionals.
Other questions or perhaps a motion?
Dr. Shealy, would you remind, the 2024 one was different from the newsletter, how that we approved a one-time administrative suspension?
So the transcript from the November 2024 meeting states that there was several conversations or discussions about this process over several meetings within executive session, which would not be accessible to me. And so what it then says is, so I want to go on record and have the board adopt the proposal that was provided to you in your board books. The difference there is because we, as a board, are not able to issue private reprimands, the board at that time did not pursue consent agreements for the 2023 failures because they were just lingering. and did an administrative suspension only. And part of that, to get back into compliance, to lift the suspension, was to complete the required CE and provide notice.
And for clarification, an administrative suspension is also something that is required to be reported to the data bank. Is that correct?
That is my understanding.
Madam Chairwoman, I make a motion that we take this agenda item up in executive session for legal advice from our counsel.
Would there be any interest in inviting Dr. Shealy to that?
Yes, please amend my motion to include Dr. Shealy.
Second.
We have a motion to take this up in executive session with Dr. Shealy in a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. We will go to 12. I'm going to hold, if it's okay with the board, I'm going to hold executive session to do all at one time. Okay. 12D, review and update resolution guidelines.
So this is a request from the board at the previous meeting. It came during Casey Smith's training for disciplinary complaint process handling, that the board review the current resolution guidelines that were updated March of 2024. This is what IRC uses whenever evaluating complaints, and the litigation summaries provided by the investigators that then make the recommendations to you as a board. So that is why they are here. And update as you see fit.
As Rebecca noted, this may be tied to our previous discussion as well. I will open for discussion or motions.
In the past, I know that when we reviewed these resolution guidelines, we formed a committee or a task force or whatever we want to call it. And I think that included like 3 board members, the administrator, and the
Okay.
and anyone else who you would, maybe Jennifer Harris. So maybe I'll make a motion that we create that committee that can schedule a time to meet to review the resolution guidelines.
I would just note, before there's a second, that if the board wishes to include the CE audit course of action in the resolution guidelines, that will need to be made. That's a decision that needs to be done likely during this board meeting or tomorrow. That if we form a committee, we probably are not going to capture the CE audits for this year.
So can I amend my motion to include adding the CE audits in the review of the resolution guidelines? Because they're going to be reviewing the resolution guidelines.
I think what Carolyn is saying is that there's a sense of urgency for a resolution guideline around CE audits that may be, like today, tomorrow, that may be delayed to move forward on the other kind of review of them. If we could take up some resolution guidelines before others.
I was going to recommend a preset timeframe quickly in terms of having this committee formed and within, by December 31st, whatever it is, have this done.
There is a motion on the table, so that needs to be taken up first.
I'll rescind my motion so we can come up with game.
Thank you.
Okay, maybe this is executive session. I thought the resolution guidelines are just guidelines and didn't require a motion. Like we could just add CE audit requires a board vote.
Likely this is best taken up in executive session, but generally speaking, your resolution guidelines are a board approved recommended outcome for various fact patterns. But again, it's not case specific, but I would think that a vote would be needed. But I think that we could discuss it further in executive session, but I think probably because that might have impacted the.
Okay. Madam Chairwoman, I make a motion that we take up the resolution guidelines discussion in executive session for advice from our legal counsel.
Anyone else to that you would like?
To include Dr. Shealy, please.
Okay. We have a motion to take this up in executive session with Dr. Shealy. Anyone, any second?
Second.
Motion is second. All those in favor say aye.
Aye.
Opposed? And the motion carries. So we will follow that up in executive session as well. All right, new business 12E, clarification regarding additional attempts for licensing exams, MPJE, and NAPLEX.
So this has come up a couple of times since I have started here at the board. I'm also aware of previous presentations and discussions as a board regarding NAPLEX and MPJE attempts. Specifically, since we have discussed kind of the uniform option and the opportunity that I will ask the board to formally decide on at a future meeting to allow students an opportunity to take the MPJE early, also wanted to take an opportunity to bring back for this board, because we do have new board members, to discuss and kind of reaffirm the board's wishes on how to handle additional attempts. So part of that, the chair requested certain material to be available to you. So what you have are previous board minutes from June, I think June of 2023. You also have the transcript from that meeting where there is a representative from NABP, who handles the exams and kind of reviews all the psychometrics of exams, that is there for you, that they presented to this board. And then I feel like there's one more piece. I also have put for you an email correspondence asking NABP to clarify whether, if this board said no to additional attempts, meaning that the candidate has exceeded or has reached the maximum number of exam attempts for either NAPLEX or MPJE, which NABP sets at 5 before sending them back to the board, or the board could choose something different. But if they reach those max attempts in a jurisdiction, can that candidate go to another jurisdiction and seek additional attempt there? And so you have that correspondence, just so that you all are more informed to determine how you want to proceed.
And she's correct. I did request all these documents, and I greatly appreciate the fact-finding mission that you did there. I know that wasn't necessarily easy. I would also like to say, like she said, that meeting was several years ago. There were some members here, some members not here. We are not necessarily held to prior decisions by a previous board. So keep that in mind. There's also the balance of consistency. So I want us, to make decisions on a case-by-case basis and look at these individuals, but also kind of just knowing the history of some of these cases as they come up is really helpful. So I hope that provided the past conversations and also being sympathetic to staff, we give staff direction, and then, either because personally I forget what we decided before, or the board itself forgets, or we get new members and we have different opinions, that can be kind of confusing to our staff as well. So I am open to having discussion related to this, feelings or opinions.
I'll start off just about throwing some questions out there as well. So in our practice act, it only says that they have to pass NAPLEX and MPJE, right? There is no part of our statute that says 5. We kind of default to an ABP there. With regards to the material that was provided, again, I was part of that 2023 group, and of course, I think I've made my perspective known, but I did take specific liking to Minnesota's, where theirs was petition after 3. So in regards to coming before the board after a third attempt, which Yasmina from NABP recap for hers, after the third attempt, you see the pass rates fall significantly. And so there's really no additive benefit after the third attempt. So I think if we get in there earlier and start them petitioning at 3+, we might have a little bit more success rate in that 4th or 5th attempt, or maybe we can help them along the way. I don't know. I just think that 5 to 6, just my personal opinion, again, not the board's pleasure by any means, is frivolous and unnecessary. But
I agree with you that there's some, I guess, skin in the game if they have to come before the Board of Pharmacy, and it would change potentially their study habits between third and fourth attempt. So, I mean, I agree. I like the limit of 5, but I feel like a lot of times we set it at 5 and they come in for one more, and it tugs at your heartstrings to give them one more chance, because then they have skin in the game. So then it goes to 6. So I'm not opposed to keeping the limit at 5, but after 3, have a board appearance.
if you petition at 3+, or Beverly, go ahead.
I was going to say, there's a couple of other states that cap it at 3, but then come back with a study plan. I've worked with several certification boards, and you're right, the success rate falls off precipitously after a year or 2. So if they have to put some skin in the game and come back with a study plan for subsequent approvals, that might be helpful.
Also, anxiety is a trend that, students talk to us about. So not only a study plan, but test taking help or counseling might be advised. And I know NABP just had some changes in their questions, which did cause a lot of recent failure. What NABP is doing with the test.
Also, exam integrity, to your point as well. But I like that in terms of one of the examples was accommodation. They had taken it 5 times, hadn't had an accommodation, and we were essentially like, why? So maybe if we get them in here earlier, we can remind them of that privilege.
Since the discussion has come up, I am sure that this would be appreciated by the schools and colleges. Sometimes when the person has requested a third attempt, we have said something along the lines of, go back to your university and consult with them. And while I think that intention is good, it is kind of confusing and a logistical nightmare, right? So that candidate is no longer a student, they are a graduate. So we use the term student, but they're not a student anymore. They're a candidate, and they don't belong to that university anymore. They're not paying tuition or anything like that. I don't think that's bad advice for them to go back to an entity that they know and that has, invested in them as well. But what are our expectations of that requirement? Do we mean that we want the School of Pharmacy to report back how many times they saw them, how long they did, did they go back through a class and audit? Because we always just left as this nebulous, go back to your university and get help, I believe that left the universities in a logistical thing of like, what do you want us to do? We'll do it, but we don't know what to do and how to report that back. So as some recovering academics here in the mix, I think that we could, take advantage of that and resolve that kind of issue that has come up as well.
This is just another thought to Rebecca's point earlier about something else. They are professionals. I mean, even though they're not licensed, they are graduates. They have a PharmD degree bestowed upon them. And so they are professionals. They've achieved that academic success. Part of it is come before us, petition, but then you're grown up, right? We don't need to, standard of care model for everything else. We don't need to prescribe exactly what you need to do because each person's different. So come, let us ask some questions, let us get to the root cause, help you, give you some ideas, but then it's up to you within a set time frame as well.
I would agree with that. With the idea of going back to your university, I do think the universities have some sort of stake in the game that they want their graduates to pass. That looks good on their university and everything like that, and that there are possibly options they can put forth to help people. But at the end of the day, it's that candidate's responsibility. And I agree that they're professionals, they're adults, and I like the idea of after 3 coming before the Board of Petitioning so that, like you were saying, you can help them along, maybe give them some ideas, but that that they've sat down, they've formulated a plan because they had to present it, and then it gives them some stake in the game, like you were saying, that, okay, I better do something different this time because obviously what I've been doing before is not working.
Yeah, so I like that as well for the third time, but Schuler, are you still leaving it in your thoughts the 5th time, and then if the board approves, or you could take it a time or stopping at 5?
I think you can, if we start petitioning at 3+, I mean, I would assume most boards, I don't know what's happened after us, but I would assume that most boards will probably say 5 at that point, because we've already met with you twice, because you have to come back at 3, or after the 3rd failure, 4th failure, okay. That would be up to them at that time, but I'd be in favor of 5, but personally, I wouldn't think it would need to be prescribed.
Is there any reason, I mean, obviously they're petitioning for an attempt, basically. Is there any reason that after 3 that you could imagine where you wouldn't grant it? Or is it they basically just procedural that they come, present, and then they are granted it, and then 5 is the end all? I mean, just throwing ideas out there, like limit.
I believe the wording that was shared with us is recognizes and supports the NABP retake policy at 5 maximum. So I kind of like that wording too.
It's your question. Me, Schuler, individually, absolutely. I can think of a ton, but not as board now.
Gotcha.
As you are considering this, I would ask that you also consider those individuals who are now in limbo between the 3rd. Currently, they're on their 4th and 5th attempt. So, excuse me, just maybe wanting to include them in this thought process.
Thank you.
Gary, would that look like a sunset date or a?
Or like a, what do you call it? The grandfathered in, like if they've already, it would be like something we need to think about, but we could grandfather the people that have already taken it 4 times to take an additional time without coming before the board, since
That is an option. You can say that, I think that if you're already registered, scheduled to take the exam, that ship has sailed. Sorry, I'm reading base it on their graduation date. You could base it, you could say that if you have not already scheduled and you have already taken, 4 exams before you petition for the 5th, you need to come back before the board. You have a lot of options.
So when reading these, most of them do not say they have to come before the board. It just says that they need to submit to the board the study plan. Do you think we're going to get like a ton of people coming in here?
I don't know, but it is an option that you all could delegate either to staff or to particular board members to review and meet with those individuals as a procedural matter, or you could require them to appear before the board. It can be either, but it is something you could delegate.
Do we have any idea of the numbers that
Yeah,
this
that's what I was
looks
gonna ask
like?
as well.
With regards to okay, they've reached 3rd attempt, they're looking at 4 and 5. I mean, as a new board member, I think we've seen a couple petitions, but I don't know a lot historically if we say they need to start petitioning, how many people are we going to be talking about potentially coming before us? Any ideas?
Can ABP give us that number for some data purposes?
They could, because I think that's a good number. Like if we say 3 and they have to petition the board, are we going to see 300 people? Not really, but are we opening up a can of worms? Or is failure rate significantly less after the 3rd attempt? I think we need numbers before we.
If you look at Alabama, they talk about how they just maybe we could have a list of approved courses that we recommend.
Only potential problem with that is if that course is no longer available, then
professionals, they can find some courses.
I think that we need to remember to speak into the microphones.
Oh, I'm sorry. I
You
said
could bring
if
them closer to you.
not having individuals take responsibility for finding courses seems to put a good deal of onus onto our staff, which honestly doesn't need that much more work.
I also think there's something to be said for coming before the board versus it being an administrative thing and the seriousness of what you are asking for, whereas if you can just submit something to staff and they can administratively approve or deny or whatever it is, it's very different than coming and sitting in here and talking to the full board about something.
We make a motion to reach out to NABP to gather some data before we move forward.
You could just make a request of your board executive to do so, and I'm sure she would love to do that for you. No motion is required. You can also keep this on as like a rolling agenda item so that it is considered and taken up at the next board meeting.
One of the other questions that I had are specific to that email that we have in our board book requesting information from NABP about just going to a different jurisdiction if they max out in one specific jurisdiction. Does that happen a lot coming into South Carolina? Or is that do we see that where people are coming here to request, this being their home state, can I take another test, when maybe they weren't initially looking to be here?
I don't know that I have specific numbers, but just anecdotally, yes, we have been asked for additional attempts. And we were not the first jurisdiction.
Two comments I have from things that I have learned at NABP District 3 is up to 8% of graduates are electing not to take the NAPLEX at all. They are going into positions that do not require licensure. These are often in industry, so it requires a PharmD, but not an RPH. And what was the other thing? Now I can't remember. It'll come to me. I will also suggest we could keep this as a rolling item. I would also suggest we could table this and maybe think over it tonight and bring back up for discussion tomorrow if we kind of have some ideas or some revelation as well.
Is it something that we would maybe want like the state universities to weigh in on, or do you think that that would be beneficial or that they might would have a say in this process? Or
I can't speak for them, but I know that the feeling too is that they're candidates, not students. And, you know, they would probably share those feelings of like, what do you want us to do?
I know we asked them a little bit when they were here at the last meeting to weigh in, and I think that was the general consensus. I just didn't know specifically talking new procedures if they might would have a different opinion.
From the gathering the school perspective, and also to keep in mind if, as you were weighing number of attempts and when might someone need to come before the board for taking the exam to be marked eligible, if you will, would be in 2026, NABP is going to expand the opportunity for states to allow the MBJE to be taken after the didactic portion of the curriculum is done, but before the student graduates. They would be able to take it once during that last year, if you will. So just, I think that would be, that was the input the schools were asked about. How would you feel about if we allowed them to take it early? Do you think that would be a student benefit? So I just wanted to kind of clarify that part. But also, I think you should keep that in mind too. If the board does choose to allow a student to take it during that last year, it would be up to the student to wish to do it. You're not mandating that they would, but would that change when you would expect a candidate to come before the board for additional attempts?
Okay.
Some additional points to consider.
And we were getting additional information about the UMPJE at some point, correct? I know that was the request of last meeting to have them come and present.
Yeah, yes. I did not ask them to come for November, given
Sure, yeah.
shortness there, but is planned for a future meeting for that. I also will just state that you should expect to see a request to take action on whether or not to allow early administration at a future meeting, likely before the UMPJE, but maybe at the same time.
Okay. I don't want to stifle discussion, but one of my duties as chair is to keep the agenda moving, especially as we approach lunchtime.
I think we can table this till tomorrow, give some extra time to think about it.
Wonderful, thank you. All right, item 12F, board travel request. Dr. Shealy, would you like to cover these?
The 4 meetings you have here are ones that we have sent board staff, and board members have attended some of these in the most recent past. And so they are coming up. Registration is open for all of these now, which is why I have these specific ones on the agenda, with the exception of item 2. So the first, if you want to take them individually or collectively, tell me how you want to do it, but just so you guys understand, the MPJE item development really is here just so that you will approve us, so for me to send 2 staff members to go. That is not an expense to our board, but just for full clarity to have that.
Yeah.
So moved on the second one.
Whatever you want. You got it.
The Compounding Summit last year, or the most recent one, which is still in 2025, so February 2025, almost all of the board staff attended, and there were 2 board members that attended, if that helps. It was an impactful meeting, especially as you're considering compounding regulations.
Can you tell me, content-wise, does it change year to year? Is it like a one-time kind of training thing, or is it like a new material each year? There's a benefit to even all staff going every year?
So it is not a training. It is specific presentations that are put together. So it changes every year.
And does Advice or ODC attend any of these conferences?
Advice has attended the annual NABP annual meeting, as far as I understand. And prior to me coming here, had firsthand experience meeting the board's advice council at an NABP meeting. No to the other ones.
We taking motions right now?
I'd be glad to.
Madam Chair, in regards to 12F1 for the North Carolina Compounding Summit in Chapel Hill, I make a motion that we approve 2 board members, any and all staff, advice council to attend.
We have a motion to allow for all interested staff and advice council, as well as 2 board members to attend the North Carolina Compounding Summit. Is there a second? Second. Any discussion?
I will happily be one of those.
I'd like to be one of those as well.
Is there interest beyond 2 members that we need to increase that of board members?
I just need to check my schedule, but I'd be interested in the compounding summit as well.
Madam Chair, I will.
I think that there is a general policy to only have 2 members attend any particular conference for a number of reasons, but I can double check
Designated
that.
survivor reasons, like they can't be on the same plane?
No, I think
And I maybe double check, but I feel like in light of us promulgating compounding
I
regs,
think there's probably room for exception. I just wanted to make sure that I mentioned that, all those who are interested can ask that send Dr. Shealy a note, and then we can seek approval for all of those. I just wanted to make sure, one, and also ensure we don't have a quorum.
Yep. I would like to go ahead, Dr. Shealy.
I was just going to confirm that there is a agency policy that sets a cap generally at 2 board members per travel things, but can be exceeded with extenuating circumstances with board approval or delegated to the chair to approve if that needs to come in between board meetings.
Perspective of reimbursement, you could go on your own if you chose to.
Yes and no. So yes, for the aspect of making sure that the board is able to provide that expense. And no, because it also, as Carolyn suggested, ensuring that the board members being together at a function is not considered a board meeting. So I think there are 2 layers, and so that's why we have to be kind of careful and make sure that the board is in agreement to send XYZ people. But a board member could attend other functions as long as it's open to, if it would be open to you outside of being a member of the board, then you're welcome to attend it. And does that answer your question?
So we have a motion and a second to send 2 board members.
Madam Chair, may I amend that to be up to 4, considering the circumstances we find ourselves with compound or promulgating regulations in regards to compounding?
Okay, so we have an amendment of up to 4 board members and all interested staff and advice council. Is there a second?
Second.
Motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. If you are an individual interested in attending that, please connect with Dr. Shealy, and she will let us know if and when we reach that 4. Thank you.
I should also just point out that my predecessor, Tracy Collier, is one of the speakers at this year's, or this upcoming one, so.
Sounds good.
That's going to be the main line event right there.
The live stream can't tell, but she's here in the room. Okay. Next up, MPJE, item writing development. So this is writing questions for the MPJE exam. You do have some brief training on that. When you go up there, I'm looking at y'all because y'all have done it before. You sit in a room, you look at the law, and you write it.
I did remotely. The one time I did it.
Sit in your own room and write them.
So last year, we just had board staff, 2 board staff, and also a representative from DPH attended. So
sounds like a good place to start.
So, Madam Chair, do you feel like there's any added value to a board member being on that, or Dr. Shealy?
So my personal opinion is that consistency at things like this is probably the best course of action, so that, because it's actually, there are 2 portions. There's writing questions, which is this section, and then there's a review portion that happens in the fall. Given that this is for the law exam that all licensees in our state have to take and pass, my just comment would be we should be consistent or strive for consistency in the writing as well as the review of for the fairness of candidates, if that makes sense. I say that because if you have some states, some jurisdictions do send board members, and it's a different board member every time, and you could get a very wide swing of
questions,
stuff.
Mm-hmm.
So I'll
Topics.
just say that.
Any motion to consider?
Make a motion that we send 2 staff members, as we did have previously, to remain consistent.
I have a motion. Do I have a second? Motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. SCSHP annual meeting in Kiowa. Really going to test the boundaries of that travel policy we just set forth.
So as
No
you,
smile. No
as
having
you
fun.
heard from SCSHP, the board staff have had a booth, if you will, at SCSHP as well as SCPHA. The associations provide that booth to us at no charge as a courtesy. So this is approval for us to send however many staff. I don't think we need more than 2 personally to attend these meetings for the purpose of having an informational booth. And that really is to help people get to know the staff of the board who attend these meetings. that is my specific ask, but you're also welcome to send others from the board to attend the meeting for the meeting itself if you wish.
Motion?
So moved.
We have a motion to send 2 staff members to help man the booth at the SCSHP annual meeting. Do I have a second? A motion and a second. All those in favor say aye.
Aye.
Opposed, say nay. The motion carries. All right, and finally, the NABP annual meeting in Boston, Massachusetts, May 12th through 15th. This one will require a delegate.
So the board will need to identify a delegate. You don't have to do that today. I have not been asked to submit that yet by NABP. We likely could take that up in January, but that is something that you will need to identify a delegate for voting purposes at this meeting.
And an alternative, correct?
Yes, and an alternative.
And can the delegate be any member of the board?
Yes, as far as I understand, it's whoever you wish.
About staff? Staff attend NABP?
Yes.
How many would you request?
I have approximately 4, not including myself, who would be interested in attending. Some of them, this would be their first time getting involved with NABP.
Madam Chairwoman, I'd make a motion to send up to 5 staff members and up to 3 board members to the NABP.
Vice Counsel?
Vice Counsel.
So we have a motion to send up to 5 staff members, 3 board members, and a vice counsel interested to the NABP annual meeting.
I would just reiterate that, once again, we are capped at 2 board members, but with extenuating circumstances, I'm not sure what the NABP annual conference might be an extenuating circumstance, but I haven't been to the annual meeting, so it might be beneficial considering our regulations that are pending.
I can add a comment to Dr. Gillespie's motion. I think that is very current in regards to the information that is presented and in application to our profession. So I think.
Sorry.
Oh, no, go ahead.
Furthermore, I was going to say, we have a lot of new board members, and I think it's a really good introduction to the regulation of boards of pharmacies. So I think there's some value there.
Okay, I have a motion. Do I have a second? Motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries.
Black, you made the second.
Thank you.
Okay, again, if you're interested in any of those meetings that we have made available, please talk to Dr. Shealy. We have reached the morning agenda. Lunch has just rolled in. We could also decide to take up executive session during our lunch break and set a time to come back. Dr. Shealy, do you have any comments related to that? You look like you're about to say something. Oh, no, you're good? Okay.
Madam Chairwoman, I make a motion that we go into executive session to seek legal advice from our counsel and Dr. Shealy to stay in that session.
Okay, we have a motion
Second.
and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. We will return back after executive session. And we will take a convenience break now. Okay, I have a thumbs up. So thank you for your patience while we were in executive session. As a reminder, no decisions were made, no motions were called.
Madam Chair, I'll make a motion to come out of executive session.
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Opposed, and the motion carries. We are now out of executive session. So we will resume our agenda now to item 13. 13A has requested a continuance. No motion for that? Okay. 13B has also requested a continuance. And so they have been requested to reschedule an appearance at another meeting. So I'm going to go to 13C, request approval of pharmacy technician application, IKEA Williams. Okay, so we will get Williams here.
Generally speaking, application hearings are open to the public, and therefore all of the applicants can be present.
Okay. Sure, we can go out of order. I will go ahead and move the agenda item. We can go to 13D, request approval of pharmacy technician application, Kynesha A. Roberts. Hi, Ms. Roberts. I'm going to give you a little instruction here. So these are our microphones. You can pull it as close to you as you want. It will automatically pick up your voice. When you talk into it, you'll see this red line. The trick is you have to talk very closely to it. It will feel awkward, but it's okay. We're all kind of used to it at this point. All right. So this hearing is called to order. This is the matter of Kynesha Ashante Roberts. The purpose of this hearing is to determine whether Ms. Roberts' technician application for registration as a pharmacy technician should be granted. Everyone is reminded that these proceedings are being recorded and that all witnesses must be sworn in before they testify. All remarks should be directed to the board. My name is Mary Douglas Smith. I am the chair of the South Carolina Board of Pharmacy. The attorney assigned to advise us during this hearing is Carolyn Sutherland, Office of Advice Counsel with LLR. A quorum of the board is present. Do any of the board members have reason to recuse themselves from this matter? Okay, hearing none, this hearing will be held in accordance with the provisions of the South Carolina Administrative Procedures Act and the statutes and regulations of the South Carolina Board of Pharmacy. Dr. Shealy, have the board members received Ms. Roberts' application?
Yes.
Okay, and did the staff subpoena any other persons to be here today?
No.
And what questions does staff have concerning this application?
Ms. Roberts submitted an application for registration as a pharmacy technician of this year. On that application and with her nolo contendere or was convicted of the following felony conviction for possession with intent to distribute a Schedule 1, as well as a 2017 felony conviction for
Okay, thank you. As a reminder, speak directly into the microphone.
Thank you. I thought I was.
Is the applicant present?
Yes.
Okay. Ms. Roberts, are you represented by counsel or an attorney?
No, ma'am.
Okay, you understand that you have that right and you're electing to waive it?
Yes, ma'am.
Okay, and do you have witnesses that you intend to call on your behalf?
No.
Okay, and has the court reporter received a government-issued photo ID from the applicant? Okay, can we get one? Do you have an ID? Thank you. And then, Ms. Roberts, at this time, if you will please stand and state your name for the record, and the court reporter will swear you in. All right, thank you. So, Ms. Roberts, is there anything you wish to tell the board in regards to your application for a technician license?
So I'm glad that you all have me here today to try to see if we can work something out, because the charges that I have, they are about 10 years old almost. I just want to let you all know that I was underage at the time of the offense. And I'm just really trying to better myself for me and my kids, and I would like to see if I can move forward from it.
Okay. Board members, do you have any questions for Ms. Roberts?
Ms. Roberts, do you currently work in a pharmacy?
I do not.
Do you have any current jobs lined up or hopes?
Yes, I've been applying for pharmacy jobs. I'm just waiting to hear back.
Roberts, in your letter that you provided to the board, you mentioned that this all came about from contact with a person who is incarcerated. Are you still in contact with?
No, sir.
So one of the reasons that we have these hearings is that we want to feel assured that when you are in a pharmacy setting, that you are practicing safe practice. Some of the things we worry about could be diversion of medications. You know, the controlled substances have a lot of value in a pharmacy, and we don't want those being put out of the pharmacy without a prescription or diverted either for your own use or for someone else's use. And so maybe speak to us about some assurances of, you know, some of your past behavior and maybe your current behavior. You did provide some of this in your letter, and that's appreciated, but I'd love to open this opportunity for you to kind of tell us more about that.
So my past experience would be I do not associate myself with any such things like with the drugs and things like that. So at the time of the offense, when the friend did contact me to do a favor for him, I was not aware of what exactly was in the package that I was picking up. No, I did not ask any questions or anything like that, which I should have, but I'm thinking that that was a friend that I had for a very long time, so I'm not thinking that he would put me in that situation. And I also expected for him to give me the choice, well, the option, you know, let me know what is inside of the package and let that be the decision for me to make if I wanted to proceed with that. And that has been my only offense that I've had other than like driving offenses. So moving forward from that, like as of today, I don't associate myself with the guy. And I stay away from people that, you know, may have those type of things going on.
Have you worked in any other healthcare setting to this point yet?
Just customer service.
Okay. And can you tell us about your career goals, maybe as related to pharmacy?
So I've just had a career change actually, because in the past I've been in like manufacturing. I work with medical supplies and things like that, so that's important. And so I used to do cosmetology, but like I say, now I've had a career change, and I'm looking forward to working in either nursing or pharmacy, just trying to get in that field.
A situation like the one that happened to you about 8 years ago happen to you again, how would your today self deal with it?
If that were to happen to me today, I would see it coming before it even happened. So I wouldn't even put myself in that situation. I'm not too fast to do any favors for anyone, picking up anything and dropping off. I'm not doing that. So I would avoid that at all costs.
Madam Chair, I make a motion that we approve Ms. Williams, I'm sorry, Ms. Roberts' license.
Second.
Second.
Motion and a second to approve her license application. All those in favor say aye.
Aye.
Opposed? And the motion carries. Congratulations.
Thank you all so much.
You're welcome. So it will proceed through the application process, and you can follow up with the board tomorrow
Okay.
or later this week
All
about that
right.
status. Thank you. Congratulations.
Thank you all. Y'all have a good day.
All right, so we are going to short-term hold on to item 13C. Our 13E and 13F will need to be done in closed session. So I will need a motion to enter into closed session.
So moved.
In a second.
Second.
All those in favor say aye.
Aye.
Okay, and the motion carries. So we will take up 13E, which is request approval of pharmacy technician application for Trevi Mason. Is that you? Okay.
We have IT here. Before we proceed, we need to have IT.
Closed session. Sure. Ms. Mason, you could go ahead and have a seat in this chair. I will give you the same instructions as before. Just right into the microphone as close as you can get. We are not going to begin right away because yours is a closed session, and so we are going to get technology in here to make sure we're off of our live stream. So if you'll just hang tight for just a minute. Okay. We have a request to kind of recap some of the items that we have tabled. So under new business, 12C, approved CE audit failure, administrative suspension, and/or consent agreement parameters. Dr. Shealy kind of presented the information that we have in front of us. We have also sought legal counsel from our attorney regarding that. In our we noted that we have a audit period that we are in the middle of right now, and very quickly we will be entering into the next renewal period. And so I do think we have a sense of urgency to clear up what is in front of us now, the results of that particular audit as we prepare for next year, and then maybe have a better timed response for next year for the CE audits, now that we're kind of all in place and, advice council and Dr. Shealy and everything else. So we did get some good information from our attorney regarding that, of what our options are. Another option that closely aligns was 12D, review and update resolution guidelines. So we have resolution guidelines that we can use to give us guidance about discipline. The last time that these were reviewed was in March 2024. I think that's right. And so we do like to review these annually-ish and see if they're still correct, still apply, still applicable. And so in the past, what we have done with those is created a task force to sit and look at them probably line by line and sign off on them, give recommendations for changes to be considered by the whole board. We can certainly do that again. For some of these, there may be more of a sense of urgency to address before others. So that is something that we may need to talk about today and or tomorrow. And then 12E, clarification regarding additional attempts for licensing exam. We have been provided a lot of information related to the MPJE and the NAPLEX, specifically additional attempts that may be approved by the board after a failure or a couple failures. And so looked at what other states have. Some states have that a board appearance or a board submission of materials is required from the candidate to show, say, after 3 failures that they have to submit or appear before the board to say, an evaluation of their current studying, of their current preparation, what they're going to change to ensure success on a 4th attempt. And we also saw that many states reaffirm affirm and recognize NABP's 5-attempt maximum. And some states have none. And some states don't require the NAPLEX. So there's also that. So I think we want to consider what's in the best interest for public safety and considering what those are. Oh, actually, Jennifer's looking at me. All states require the NAPLEX. Some don't require the MPJE. Thank you. Yeah, I got a little carried away on exams there. I will fix it. Don't worry. Okay, so did I capture all the items? Did I miss any? Okay, I am happy to entertain any discussion related to this.
Well, I was just going to say, I did a little bit of just Googling. And NABP reported the pass rates in 2024 of our 3 pharmacy schools in South Carolina. And if you do the quick little calculations, there were 15 students that did not pass the first time. So they don't have the additional times. So of those 15, I would suspect some portion of those would pass either the second or the third time. So we're not looking at a large majority that would have to come before us. So that gives me a little bit of comfort just to kind of put those little raw data.
And I would think it's a correct assumption that most of our applicants for licensure do come from within the state. I mean, of course, we see some from out of state, either through residency or moving or just want to apply here. But I think that gives us a good ballpark of the difference between 15 and 300.
I think that there was discussion about asking our board executive to reach out to NABP to find some additional information before the I just don't know what specific information.
I think it was more this. I mean, it was like just to kind of get an idea of this, and it satisfied it for me by just calculating.
Actually, I had another question that I wanted to ask. It's kind of along the same collecting numbers line. Since we were entertaining the idea of having an official board petition or an appearance before the board for like a fourth and fifth attempt or whatnot, there's a couple states that require that. Do we know if it's had any positive effect on their pass rate after the third attempt? Or, I mean, I wonder if that's even something NABP is tracking. Like if that's a process that's put in place that's actually helpful for this candidates.
We reach out to the states that have that in place now with the third attempt and ask them.
Does that data point inform our decision about minimum competency, though?
I think I don't want to. I was just going to put a motion on the floor that a motion that the times and then come before the board on the fourth and fifth time option to keep it the same. But we can be conservative on that. That can just be a hard. At the third time, I think you probably need to come before the board. Option, we say yes or no.
So would they be seeking, and this is just to clarify, so candidates should seek a board hearing to request approval for a fourth attempt. If that's failed, they should seek approval for a fifth attempt. And if that's unsuccessful, seek an attempt for
not in the microphone, and therefore you're not being picked up on either WebEx or by the court reporter.
I apologize. So on the sixth time, we can say, yes, you can take it again, or no, we can't, just like we've done other people in the past. So in the past, I think no one's came at the third time. It's always
Right.
waited to the fifth time, then you were granted another opportunity. Is that how it's been done in the past?
Just can I ask for clarification. Fourth time they're coming before the board. In your motion, can the board deny, or they just come to the board and?
From my understanding, they were coming to the board to kind of give their thoughts on how or what was affecting the score and how they were going to prepare. Right. So I felt like if I failed the test on the third time and I had to come before the board on the fourth time, I would really have a game plan on how I could pass the next time.
Okay.
Another point of clarification, please. Did I hear? I'm sorry, it's red. NABB suggest a maximum of 5 times and a good number of states, 5 if I recall the chart.
Yes, they have a limit.
Looks like we're the only one that allows us in Ohio. I think we're the only ones on per this.
There are some states who have unlimited.
Not on there. So for instance, like Florida has no limit.
Thing.
Guam has no rules, apparently.
I think my intent would be to be very conservative on the sixth time, but there could be certain situations, as we've heard in previous board things that we've had heart for. So it gives you an option rather than just a final.
Do we have a motion on the floor? Is there a second?
Trying to get there because I know that it's along the same lines of mine. I just want to make sure, I think the board does, one, Carolyn, correct me if I'm wrong, it's not in statute, they have to pass. So this is a recommendation, this would be a kind of like a guideline. It's not in our regs, it's not in statute, so how do we can just recommend they come before the board? Or can we, require it? How does that work?
I think that you can require applicants who, on the fourth attempt, need to come and present themselves with a plan, as
Right.
long as you're not denying them access to taking the exam. I think if you can cap it at 5, if that's, you're just recognizing the standards that are upheld, and I think the board can deny past that. But I think on that 4th and 5th, you can make recommendations, you can talk to the students, or the candidates. But I don't know that you can deny them the access to the exam. But I think they need permission from the board specifically if they want to go past the 5.
Because we can put limitations on their application, right? So what we are saying is you cannot apply for licensure after 3 failed attempts of the NAPLEX until you have appeared before the board. For each attempt to take the NAPLEX, you are applying, correct?
So applications are submitted for, a candidate applies to NABP as well as to the Board of Pharmacy in which they are seeking licensure. Our applications are good for a year, that's agency policy. There is a 12-month, 3 attempts in 12-month time period per NABP. So I am going to assume I can try to pull past things for specifics. My assumption is that most candidates would have to reapply because they would be past that 1-year mark after the 3rd attempt.
And we would also be capturing folks who have never applied in this state and have failed 3 times and are now applying in our state.
Say that question again.
So a candidate lives in North Carolina, has taken it 3 times. They've only applied for a North Carolina license. They have failed 3 times. Now they're going to apply to South Carolina for license.
We do have the capability to see within NABP's portal total attempts.
Yeah, and so we're
once someone
saying,
has applied to us.
yeah, and so we're saying on that application, they say, if you have unsuccessfully taken the NAPLEX 3 times, you need to appear before the board.
It does not say that currently.
Well, yeah.
Okay.
I think that's, logistically, I'm trying to take what Jared is saying and make it into logistics. I will share on this document some of the verbiage here of.
Wait, there is a motion on the table, and I know we've hit discussion, but is there a second to the motion?
I can rescind the motion for more discussion. I was trying to get us kind of clear this up because we had a lot of talk about it earlier, just to take it off the agenda for tomorrow. But we can wait till tomorrow for sure.
I'm not saying you have to wait till tomorrow. I just procedurally, before we get to discussion stage, we should have a motion and then a
Let's
second.
rescind that. Let's
And-
have
okay.
a discussion.
Got it. All right, so we have a rescinded motion. And an interest to renew discussion. So on the NAPLEX attempts document, for example, Alabama says only eligible for 4th after completed additional prep as directed and approved by the Board of Pharmacy. Delaware says after 3 attempts, wait 12 months and have worked full-time as an intern, and some information there. Idaho says after a 3rd failure, must complete 30 hours of ACPE CE before eligible attempts, max of 5. Illinois, after third attempt, must furnish proof of remedial education in an approved program on subjects failed. Michigan, after third attempt, must provide BOP with certification from approved program certifying satisfactorily completed course in area of failure. Minnesota must take attempts within 18 months and must petition the BOP after third attempt. So we're seeing some words around, oh, here we go. Utah must meet with the BOP after 3 attempts, additional training prior to additional attempt. So we see the words petition, meet, provide, furnish proof, complete some X requirement.
I think we're all like, shouldn't put that on the staff to like follow up with what they did, you know, to get where they need to be. Then they have to get to the 5th times.
So were you more aligned with Utah's?
That's what I'm thinking.
Must meet with the Board of Pharmacy after 3 attempts, additional training prior to additional attempt.
Yes.
We're not going to specify necessarily, they need to come with a plan. And then the other part of your rescinded motion was okay with a 6. That would be my only problem, but I'm happy to entertain and compromise if that's what's needed.
Yeah, I
But
think it's a lot, but we just don't box
Maybe we
it
don't
something.
name it, right? So what if you went with Utah and said must appear before the Board of Pharmacy after 3 attempts? So they appear.
Want to
And then-
include them having like a study plan or something to present? Like, do we need to specify what we're expecting at that appearance?
Well, Utah says additional training prior to additional attempt. Again, I don't think we need to lay out what program they need to do, but I think that would be an expectation of the meeting or the appearance.
Washington's, it says something to the effect of like a study plan or like at least have them lay it out so that they can present it to us. Not that we need to necessarily say, oh, that's not an approved program, but like or that they put some effort into it and this is what they're.
Yeah, Washington's, I like the wording of that.
I like that one too. I just don't think we'd made it quite down that far.
Yeah.
On the list.
I like that as well.
And then just leave it after third attempt so that
Kind of
up to our
us if
discretion
it-
if it's a 4th or 5th or.
and that verbiage might be beneficial if we were to decide to allow or adopt early taking the exam after the didactic portion. So that would fit.
Boxed in, you can make discretion.
He might, would.
There was also discussion in executive session of thinking of an effective date. So if anyone is entertaining a motion, consider having an effective date. It could be January 1st. It could be May 2026, or, you know, whatever, or a graduation class. That gets a little kooky. Not everybody graduates in May, but just something to consider of an effective date in case someone is currently scheduled for their 4th attempt.
You could say something like after a third failed attempt that happens after April 1st, 2026, or whatever that date is. So it's kind of like a grandfathered in program.
I would just say effective and then insert your date. All applicants for this exam, all 4th attempt examinees or the board, or I would put that as a
Prefix? Maybe?
Yeah, I would prefix it with that.
Are we able to like, can I say, what I have gathered from what all we're discussing? I
Okay.
have kind of notes saying like if, for example, only effective January 1st, after 3 failed attempts, applicants need to come before the board to present proof of preparation or accommodations to ensure a successful test. Is that like what we're leaning to just for note purpose?
I don't know if you can use the word accommodations or can.
Well, the only reason why I included accommodations is because previously we have had some applicants or candidates that were testing unaware that they were able to use accommodations And then we granted them additional chances to take these tests once they were made aware. Do that to encompass all of that, so we don't have any questions.
Yeah, I'm going more bright line in terms of the less is better on this one, because that'll be up to, if Joe wants to bring that up, 100% that can be done in that hearing or whatever, when they come and present in terms of their study plan. I don't know necessarily, because we'll probably find out that educational, if there's a gap there, and we need to recommend that.
Okay.
But I do like your verbiage in regards to the effective January 1st. Any applicant must submit study plan and appear before the board after 3 failed attempts.
Allow time for the staff to get this out in a newsletter or some way to the,
January 1st was just for example, nothing hard line on that.
What's that?
January 1st, 2027, I mean, you know, Joe just didn't put the year there, right?
Of course.
How often is the exam provided? For example, how many people at this point would be signed up for the exam? And when graduation date? So like, if you have the ability to take it 3 times in 1 year, then we are going to presumably, if it's January 2027, hit a whole bunch of people in the beginning of 2027 who.
But it also will weed out, if somebody passes a 4th time, they won't have to come before us.
So I was just throwing out 2027 for laughs, sorry. But testing centers are the limiting set for most candidates to sign up for, and they're all over the place. So I think at the October meeting, one of the deans commented that he was made aware of one of his graduates going to another state just to test because of the availability of testing centers. So it's, I mean, they're open 5 days a week typically, maybe even more than that, and it just kind of depends, but you're fighting with all of the other places.
There's
So-
busy seasons, so June, July, August is busy. And outside of that, here, yeah, it's pretty well open. Other states, big square states, have more problems with that, like Wyoming, South Dakota type of things, but not as much here. From conversations I've had too at NABP, a lot of it is student preference or candidate preference. So a candidate might say, you know, I'm not able to find a testing time. And then when you look at it, they're like, well, I can't take it on a Friday and I can't do it on a Monday afternoon. And it's like, well, I don't know. I can't do it in Greenville, you know, and so there's always testing centers.
August of 2026, right in the middle.
I think it would be good if we didn't create a new date. Could it align or renewal or something?
not trying to get into the weeds, but we wrote must appear after a 3rd attempt or 3rd time they failed. Do we want to say to request for a 4th attempt? Because what if they just walk away? Like, what if they don't want to? You know what I'm saying? I mean, right. I don't want it to be like a punishment. Like I failed it 3 times, now I have to go before the board. It's, no, if you want to take it a 4th time, you need to ask for approval versus it being like a punishment.
Like petition for an additional attempt or something,
yeah.
adding that.
So I think what Rebecca is getting at is to seek eligibility for additional attempts. Anyone make a motion?
Madam Chairwoman, I would like to make a motion that for a candidate to seek additional attempts at an exam, whether it be the NAPLEX or the MPJE. After 3 failed attempts, they must appear before the Board of Pharmacy and submit a study plan effective June 1st, 2026.
Okay.
Said it in the beginning.
All right, so our
Second.
advice council wrote that. Thank you. We have a motion and a second, and we are not writing regulation right now, right? We are giving guidance to the application.
You are putting conditions on your applications.
Thank you. All right, so we have a motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. I believe that this board also has a request that this is shared in our usual communication with additional emphasis perhaps to our in-state schools of pharmacy so that they are aware as their fourth-year candidates prepare. Yeah.
Just for clarification, so they're going to, the 4th time they will come before us, we can also go to a 5th time and potentially a 6th time? Currently stands, or we would stop at 5?
There's nothing that, it just says
But left it
any
wide
attempt
open.
after the third fail attempt.
I think that encompassed your desire, yeah.
Perfect. I mean, I just say that because you don't know what storms people are going through at that particular time. I mean,
For sure.
personally, I think 6 times is a lot, for sure. But if somebody comes before and talks to us and we understand what that storm, discretion.
Yeah. And oftentimes we're looking over a large period of time over those 5 attempts. And so sometimes it's like I was studying the wrong thing and then I got that under control and then I had this life event and then that, and so kind of and the test changed or whatever. Yeah. So we did and it passed.
I told you.
And it will be communicated. Any other discussion items or motions?
We want to discuss the CE audit, or do we want to table that for tomorrow? I mean, in
What
my
are your
mind,
thoughts?
my mind is that
Let's do it.
we discuss the current state
Current state.
and the current audit situation, and then in addition to that, come up with what we could add to the resolution guidelines, so then we could discuss that agenda item
Okay.
and determine how we're going to move forward with that.
Okay, we have a proposal to discuss how to resolve the results of our current CE audit and those failures. Go ahead.
All right, so just to get the discussion started, my thought is, it sounds like from our administrator, from Dr. Shealy, that we have some candidates who failed. We have several that failed the audit. Some failed it because they have not responded after 4 attempts from our staff. They did not do a significant numbers of the required hours, and they attested when they renewed their application that they did do that. So they lied on their application or renewal application. And then you have potentially some applicants, pharmacists who renewed thinking they had met all the requirements, but they didn't for one reason or another. So they got the 15 hours, but they were off one of the one-off requirements or didn't meet the 50%, more of like an oversight or clerical error, if you will. And so I feel like those 2 scenarios should be handled differently.
Okay.
I feel strongly that we are dealing with professionals. And if you attest to something that you did not do on your application, that there should be an administrative suspension of your license. With that being said, I think there needs to be a pathway that you could remedy that in some capacity. So if you blatantly did not complete your hours, I think we administratively suspend the license.
Is there a proportion of those hours? I think you were kind of addressing of,
I think if you did not do 15 hours, if there was some confusion of carryover, I could understand that there was a confusion, and I think we give some discretion to the administrator and staff. But if you only completed 12 hours of continuing education and you attested on your renewal that you did 15 hours, I think you're administratively suspended as a professional.
okay, so
And I'm throwing 12 out there just as a number that
sure,
does
less
not-
than 15?
Less than 15.
Okay, so
Want to add just to clarify that the staff has already reached out to anyone who has been audited to get their input so that if there was confusion over the carryover hours, that would have been clarified or should have been clarified at this point in time.
Yeah, I guess what I'm saying is I'm giving staff information that if, I feel like if there's confusion with carryover versus being blatant and they didn't quite meet it, maybe that falls more under the ones that are potentially like a letter of caution versus administratively suspended. If that's where the confusion was versus blatantly only completing 12 hours and clicking, I attest that I did 15.
And then they, just a reminder, they also sign at the end that they attest again or hereby certify that everything was separate places, that a professional.
Right, so I think what I'm trying to get at is anything that would not be like an oversight to allow staff some leeway of somebody explaining, I failed my audit, but this is why it was, I totally thought I had met all the qualifications, but.
Missed the vaccination one or.
Right, or I thought I could carry this whenever and I missed it by a day or whatever that looks like, and given staff some discretion related to that. But if you only do 12 hours, even if you got your vaccination and or you did 14 hours, it's not 15 hours.
Madam Chair, just to continue down Dr. Gillespie's pathway, so and Dr. Shealy may be able to answer this one, to Carolyn's point, the 54 that were brought up this morning of the audits, those are the ones that have not been reconciled in any way, shape, or form. They have not responded. They don't have carryover. So we're making decisions administratively suspending or letter of caution, whatever, on those 54, correct?
So we currently have approximately 54 individuals who have failed the pharmacist audit based on our collecting of information that we have access to as well as what's been provided for a handful of reasons.
Agree with Dr. Gillespie. We're dealing with professionals. If they didn't get to 15, I also would be administratively not separating. Thank you.
They can get it.
Implementation happens now, or does that implementation happen after we post it into a Board of Pharmacy newsletter? And I know it's there now, and I know that we're not really holding hands, but
I think for this my opinion, this renewal cycle, it happens now.
Dr. Eunice, you're not reaching the microphone.
It was posted in a newsletter, the one that we read earlier, that was at the end of last year, correct? Or posted at the beginning of this year?
It's also in our statute.
Exactly.
Back upon fulfillment of the hours, correct?
I think that's the next topic to discuss. But yes, that's what.
Casey, what was your reservation? Could you give a little input about if we did it now rather than giving a little bit of time?
I think it's just a process thing where if the resolution to get back into compliance is to complete hours, and they can send that in. It's going to take us time to get the admin suspension delivered, and then if they immediately come into compliance, then time to lift it again. I don't know that I necessarily have reservations. I think it's just I think previously there is like a warning letter that was sent. You will be admin suspended on this date if we do not receive XYZ.
Yeah, that's part of like the notes I took, that we would send out a certified letter, give the applicants 10 days to reply or fix. And then there was a note that also said, if not, administrative suspension of the license, and due to the app fraud, there would be a fee. And then if they do reply, they are still suspended but are able to present proof of compliance and possibly an application fee again.
So that would be, okay, so that makes, I would be okay with that for these 54 current licensees, that we could send out 54 letters and let them get in compliance. But also, the second part of that is that discipline needs to happen because of the
Lying on
the application. So I guess it's two different steps. Is that my understanding? So then like a discipline would be opened up and they would potentially, and we'll get to this, if we put on the resolution guideline what that penalty looks like. But they need to, right now, they'll get a letter. I mean, I'm just speaking what I'm thinking. They would get a letter that would say, your license is temporarily administratively suspended. You have 10 days to get in compliance.
It could say that, or I think say it will be administratively suspended on this date. You have until that time to send.
So that way there's
makes-
a potential for it
Yeah.
to not be suspended if they become compliant before that date.
That works for me, just still in discussion for this year. I feel like moving forward, that happens at the point of audit.
I would prefer not to have to keep coming back to you.
Right.
Does staff, Dr. Shealy, do your staff have any concerns?
I'm sorry. Ms. Calhoun, you'll need to be on the microphone.
Oh, this the second.
Yeah.
Want to hear your questions and concerns, so.
Oh, you hadn't made a motion yet, so that
We
would
have
be
not.
my question.
It's okay. You can go ahead.
Okay. If the motion is for these 55 people, would be that we will send them a letter and give them 10 days to become compliant, is what we're saying. And if they do not respond in 10 days, then we will give them a next step, which will be administrative suspension. Is that my understanding?
And that is a confirmation of a discussion point we've put out, yes.
Okay. For the current pharmacist.
Yep.
So this process to be the same moving forward?
No.
Just for now? Okay, that's
Just
my
for now.
concern, just for now.
We do recognize that we kind of have two issues at play of what to do now and what to do in the future.
I guess we could say prove and/or come into compliance. I mean, if they are in compliance and they just haven't responded, it'll scare them in 10 days, but.
Right, so I want to make sure that we're clear that an administrative suspension is signed by the chair, but also it is something that they can become compliant and the administrative suspension would be lifted. Whether or not the board chooses to, in addition to an administrative suspension, have a complaint filed and that process go through OIE, whether they become compliant within 10 days or they're administratively suspended and become compliant later, the board still has the discretion to still refer that to OIE for investigation and potential discipline.
That was, I would suggest that that is a separate process, and all 54 that we currently have identified that have failed the audit, and a complaint should be filed and go through the disciplinary process.
And then is your intent, when we look at the resolution guidelines, to add then what our expectations would be for if this is a first offense, second offense?
Yes.
What they can implement?
Yes.
So that would be for these 54 people, they will get a letter, all speculation or whatever. They will get a letter saying in 10 days, you will be administratively suspended if you don't come into compliance or submit this showing you're in compliance or whatnot. And also happening, like, will that be in the same letter, or like we're anticipating those happening automatically together for these 54 patients?
I think it will just have to follow normal complaint process. Where it's filed, the complaint analyst will determine if there's jurisdiction, and then they will be notified a complaint has been filed about them.
This first process is just allowing them to continue to practice. And then a complaint will be filed against their license for forging their application.
I think it'll be muddy if we put it in this letter, because
Not forging the application, I just wanted to,
Not being truthful.
fraudulent, but not forgery.
Thank you for the clarification.
I don't know, it depends.
Okay, so Madam Chairwoman.
Yes.
As, I would like to make a motion in regards to the current CE audit, that we staff issues letters to all of the licensees who have failed the current CE audit, that gives them 10 days to come into compliance, or else their license will become administratively suspended.
Yeah, I think that's a good place to put a period. Okay, so we have a motion. Is there a second?
Second.
All right, we have a motion and a second. All those in favor say aye.
Aye.
Opposed? And the motion carries. All that documented by staff. We good? Okay, any other motions?
Madam Chairwoman, I would like to make a motion that all licensees who failed the CE audit this year go through the disciplinary process. Have a complaint filed and go through the disciplinary process,
So we,
regardless of coming into compliance.
okay, so we have a motion that all failures of the CE audit for this year have a complaint filed against their license regarding that failed audit. Do I have a second?
Second.
Okay, I have a motion and a second. Any discussion on this item? All those in favor say aye.
Aye.
Opposed? And the motion carries.
Can I ask a question? So for these 54 licensees who have failed, pretend some of them don't come into compliance after the 10 days, they get administratively suspended. What is the next step for them to get their license reinstated? Do we need to establish that right now, or is that already got a process?
That has a process. So the administrative suspension notice will have verbiage in there about how they can come into compliance. And then upon, submission of proof of completing whatever educational requirements that they have, then the administrative suspension can be lifted upon the signature of the chair.
It doesn't have to come before the board like we've seen before, that they're requesting.
The reason they would be eligible for administrative suspension is because they no longer qualify for licensure. And that is separate and distinct from whether or not the board is disciplining a license.
Need to discuss the discipline part? Or is that part of the resolution guidelines?
Can we clarify whether this also applies to techs? Is it all pharmacists and technicians, or is?
Pharmacists, right?
Oh,
We're currently auditing pharmacists, but pharmacy tech is next, rapidly underway. So I just want to clarify whether we are applying the same standards to all licensees.
Dr. Gillespie, did you did you clarify whether it was just this renewal cycle or was it pharmacists? Because I think I heard you say this renewal cycle.
I heard it.
So I think that includes both pharmacists and techs.
So for clarification, the renewal cycle for pharmacists and techs that occurred in 2025.
That motion? I'm sorry, do we need to amend that motion?
Just a matter of clarification.
Clarification, okay.
Other clarifying
Sure.
question. I heard Dr. Shealy say that she really didn't want to have to come back to us for the. Carolyn, can we have a motion that becomes effective in January of 2026 that's slightly different? Did we make modifications? Becca's only dealt with the remainder of 25, if I heard.
Yeah, so my next discussion topic was going to be moving forward, how do we want the staff to handle it on a annual basis, and getting that put into the resolution guidelines document so that everybody, new, old, on the board, will know what the ramifications of not renewing your, or doing your CE are. So, I mean, I guess up for discussion, I'll start the discussion. I think it would be similar. I just don't know the time frame of, okay, so when do you, in 2026, when do you start the audit process or anticipate starting the audit process?
So we allow for 60 days before pulling data from CPE Monitor, which is the main body of evidence, if you will, recognizing that evidence occurs outside of that, but that's a prime source for us. So 60 days after the expiration of, or the end of that renewal period or license period. So for pharmacists, it would be July 1 because April 30th being the last day of licensure. For techs, it would be September 1. I have it on a paper.
And the rationale for that is that typically after an accredited CE, you have 60 days to submit. And so that will capture all the way up to the very last day any CEs that were acquired and submitted to CPE Monitor.
Correct.
Okay, so would it be fair to say that pharmacists will be notified of, moving forward and starting in 2026, after an audit is completed by our staff, pharmacists and technicians who fail a CE audit will be notified in writing, and they will have 10 days to come in compliance?
That's including like all of the contacts to make
Yes,
sure
I don't
like
think
that
our
we've
staff
gotten.
needs to, I don't think our staff needs to go back and forth and send 4 different notifications to these professionals. I think they will be notified in writing after they failed an audit, and they will have 10 days to come in compliance, or they will be administratively suspended.
Are you asking me?
No, I'm kind of putting that out there for discussion. If you have an opinion about that, or
I think it's fair as long as we know that we have good means of contact for all of these people.
and when I say failed, I mean that's after you've gone through and brushed through it a couple of times, the process that you told us. So you get from CPE Monitor, you get that information, then you reach out to them one time and say, you failed, can you come, once you brush through it and then you've identified these people failed, then we send out the letters and they have the 10 days. Okay, and so
I would rather that not be in a motion quite yet. I just want to make sure that we are complying with the APA rules of notice. But I think it requires 2 written, and then in that second one, we can give them the 10 days.
well, but just to clarify, she's going to already have reached out to them. You failed. Can you provide outside information?
Right. So before we make a motion on it, I just want to make sure that I want to just double check everything.
I do want to clarify that those first couple of correspondences likely don't say you have failed. It is, we don't have enough evidence to say you've passed.
You have not
Please
yet passed.
submit all of the things that
Putting them on notification that you're being audited and you didn't pass on the first sweep.
Yes, yes.
Okay, so we won't make a motion, but just to continue the discussion, so that's one component. And then it is my thinking that anybody that you have identified that has failed, a complaint would be open. And we need to
An
determine.
immediate administrative suspension.
Or 10 days.
Or, go ahead.
We were going to check on the timing, but they would have a letter and have 10 days to come into compliance.
Okay.
But separate than that, no matter when they come into compliance, even if they, within the 10 days come into compliance, they still failed and should have disciplinary action. I guess my question is what that's going to look like. And it sounds like that we already have that in writing in some capacity.
Is that the verbiage of a consent agreement typically includes the following? Providing documentation of 15 hours, so that would maybe not necessarily be there. Taking the board's reciprocity course, being assessed a $250 fine, and receiving a public reprimand that is reported to the National Practitioner Data Bank.
I think it was 15 additional hours, so 30 on the next renewal.
Total of 30, yeah.
So they would have to complete their 15 to get in compliance to get their license back.
Okay, and then the
But then
discipline
their
track.
discipline would basically give them 15 more hours in addition to the hours they'd have to complete for the following year. Attend a reciprocity meeting, $250 fine, and a public reprimand.
Does that also apply to technicians for the consent?
Except for maybe the fee, but that can be a resolution.
Previously, in private consent agreements for technicians, it was a $100 fine. So a lower reduced fine. And also the number of hours was not 30, it was 10 and 10, yeah.
Again, Practice Act doesn't authorize private reprimands, and so if the board wants to consider some letters of caution for the technical, for example, I don't think we can administratively suspend someone who has met all 15 hours, but who is, for example, doesn't have the immunization. The board staff needs guidance as to how to handle those types of cases. Does the board want to have, for example, a complaint open and the resolution guideline can be a letter of caution? Or does the board wish to have a letter sent just telling them that they cannot, practice this? Until they have completed the CE hour or compliance?
My question is, do we have to have a motion, or can this be part of the resolution guideline motion so that the group, the task force that gets together can discuss that for the board to then approve at the next meeting?
I think for these cases, your staff will have a handful that will need some resolution, some guidance from the board before the next meeting.
Well, I thought we already handled those separately.
This is
This is
2026
just for
audit.
2026 audit. So would that be okay to give that to the task force to generate adding that to the CE audit to the resolution guideline and then come back for approval from the board? Okay. Madam Chairwoman, can I make a part in the resolution guidelines? That's a different agenda item. Can we move?
Yeah.
Okay. So in regards to agenda item 12D, review and update resolution guidelines, I make a motion that we create a task force created of 3 members of the Board of Pharmacy, our advice council, our administrator, and the attorney from ODC to review the resolution guidelines, update and add to them as they see fit, but also make sure that they add failure of the CE audit for both pharmacists and technicians.
Okay, we have a motion on the floor. Is there a second?
Second.
A motion and a second. Any more discussion? All those in favor say aye.
Aye.
Opposed? And the motion carries. Thank you.
Who are the three? Board members.
Oh, I don't know. Would we like to take volunteers to participate on the resolution guideline task force?
I'm happy to volunteer.
Cassie, Dottie, Rebecca, Schuler? 3 or 4?
Yeah, who was it?
I will relinquish my
Okay.
volunteer.
Not Schuler. All right, so Rebecca, Dottie, and Cassie? Thank you.
Second. No, we don't need a motion.
So when they meet, that will not be a
Dr.
quorum.
Shealy, will you send out an email to orchestrate that meeting?
Absolutely.
Thank you.
It's not a committee, it's a task force. Do we?
I will volunteer to be the chair.
Okay, thank you. Other items for discussion or motions to make?
My battery is dying, so if nobody else has any motions, I make a motion to, oh, we don't need to adjourn because we're one meeting, right?
Yeah, I think we would recess. Dr. Shealy, did you have any items for us?
I would just like to offer for consideration, if you opted to consider of the task force, at least one of our investigators being a member of it, as they are ones who often present to IRC and guide those members to resolution guidelines.
I will amend my motion to include one investigator. Inspector or investigator?
Investigators.
Investigator.
Statute lumps them together, but we separate them.
Right, an investigator.
An amended motion to
to the
include.
task force.
Yep. And a second by Joe. All those in favor say aye.
Aye.
Opposed? And the motion carries with the amendment. Now, Schuler, do you have any amendments? Motions?
Make a motion to recess
He will
until
recess
November 20th.
until our meeting tomorrow at 9 a.m.
So
All
moved.
good? All those in favor say aye.
Aye.
Opposed? And the motion carries. We will see you in the morning.